University Hospital this afternoon over what they say are unsafe working conditions. The INMO says staff are unable to take adequate breaks or use their annual leave because of excessive workloads. Anne Burke is the organisation's industrial relations officer for the area.
Our members work extremely hard at work, but they can only provide care to the best of their ability, and they know that despite going in there to work every day and every night trying to do their best, that there simply aren't enough of them to provide timely and safe care to the patients in Mayo University Hospital.
Annie lingering mist and fog will clear this morning, leaving a generally dry and bright day with spells of sunshine. Top temperatures 9 or 10 degrees Celsius in a light west to northwest breeze. Those winds will back southwesterly by evening. And that's Highland Radio News. We're back with news in full at 10 o'clock.
Black Tag sale now on at Curry's PC World with amazing savings like save a massive €500 on the LG American style fridge freezer with water dispenser, now only $999. Save €470 on the Sony 65-inch smart 4K Ultra HD TV, now just $1,679. And save €80 on the HP 15.6-inch laptop with AMD Ryzen 3 processor, now $449. Get in store or online at currys.ie.
Today's 9 till noon show is brought to you in association with Ulster Tyres. Winter is coming. Get your tyres winter ready. Call in to Ulster Tyres in Letterkenny and Ballybuffet today.
And now, it's time for the talk of the Northwest. The 9 to noon show with Greg Hughes on Highland Radio.
Hello, good morning. Start of another week, start of another 9 till noon show. It's Monday the 15th of November at just turning 5 minutes past 9. You're very welcome along to the programme. I hope you enjoyed your weekend, had a good weekend, and you'll stay with us throughout the course of this show and throughout the day here on Highland Radio. A busy show, an interesting show, lots to talk about lined up for you, but of course we want your views and for you to raise your topics as well. How do you do it? Well, you WhatsApp or you text the following number. It's 086 60 25000, 086 60 25000, and if you want to call Caroline, it's 074 91 25000. Your emails to comments at highlandradio.com. And good morning if you choose to watch or listen to the show on our social media. We're broadcasting live right now. Highland Radio News and Sport and Highland Hub on Facebook, and also Highland Radio Ireland if you want to watch us on YouTube, and you can access that live stream through our website, highlandradio.com. So we have you covered. All we need now is for you to stay with us, of course. Now, let's start with the newspapers. The Donegal News, a lovely picture of our Lee Gooch and Noah. They switched on the Star of Hope at the Polestar roundabout on Saturday evening. I watched it live on Facebook. A lovely event, it seemed. But the main story is a mother who lost her teenage son in a car crash has made a heartfelt plea to the public to be respectful and mindful on the road. Carmel Boner from Dunlow lost her 19-year-old son, Jamie, last September when he was killed in a two-car collision on the N56 near Creasla. To mark World Remembrance Day for road victims this Sunday, Carmel has spoken out about the very tough journey families face after losing a loved one. You can read more inside that paper on that very important story today. The Derry News, a new creative writing competition inspired by the words of Lara McKee was launched in Derry at the weekend. Ms. McKee, a 29-year-old journalist, was shot dead by a new IRA gunman while watching rioting on Fannin Drive in the Cregan area on April 18, 2019. The two-stranded competition has been inspired by It Won't Always Be Like This. It will get better from the pen of the young journalist and writer. On to the nationals now, and as you can imagine, COVID very much in the news at the moment, and it's not about the cases that people are particularly concerned about. It's the hospitals and the fact that hospitals are under a great deal of pressure. We have hundreds of people being treated with COVID, being helped to breathe and getting very intensive care. In actual intensive care, it's around about 106, 107. But those on wards or in certain areas of the hospital getting not intrusive care, but, intensive care, but it's not in an intensive care ward. It's going up and up, unfortunately. And hospital emergency departments are creaking under high patient numbers with winter viruses and the COVID pandemic heaping on the pressure. The Irish Independent Survey found that the majority of hospital groups nationwide are now reporting higher patient numbers than usual. This is already leading to long waits for ward beds, with some hospitals now asking non-urgent cases to avoid the ED where possible. University Hospital Limerick is among the hardest hit. It is experiencing a historically high level of A&E visitors, with 71 staff absent on one day last week alone. In Beaumont Hospital, Dublin, last month, there were 14 instances where patients waited over 24 hours. And there's more inside the papers there as well. I'm not sure if there's a reference to Letterkenny University Hospital, but I suppose we're well aware of what the situation is here. Thankfully, no one in ICU at the moment, and the number of patients in the mid to high teens, it hasn't gone way ahead of that for some time, and let's hope it stays that way. More on that in the front of the Mail, but first to the Irish Times. And the company at the centre of a bitter dispute with Sean Quinn has expressed safety concerns after the former billionaire said he remains determined to remove key directors from the business. Mr. Quinn criticised Mannock directors in a weekend interview published days after the Special Criminal Court convicted 3 men for the 2019 abduction and assault of Kevin Lunny, a senior management figure in the company. This is one of those bizarre stories that I think we'll be watching programmes about in a few years' time, and we're living through some of the developments right now. The attack on Mr. Lunny came amid a wave of death threats, violence and sabotage against the business known for years as Quinn Industrial Holdings. Mr. Quinn denies any involvement in the kidnapping or the campaign of intimidation, but told the Sunday Independent that he still wanted directors removed. And he said, "I will do anything I can do in my power to get these boys out," he said. Asked whether it had any response to his remarks, Mannock said, "From a safety perspective, his comments are concerning, but we remain encouraged at the commitment of police service at North and South to identify the paymaster and those doing the paymaster's bidding." So as I say, it's happening before our eyes, but as I say, it just feels like it's going to be a documentary we are going to be watching in a few years' time. Right, the Irish Daily Mail. Taoiseach Micheál Martin yesterday refused to rule out a return to tough restrictions. It really frustrates people, but I'm not going to keep saying it. Of course, he's not going to not rule anything out, for crying out loud. But he's refusing to rule out tough restrictions as the country battles a renewed surge in cases of COVID-19. It comes as the government has said it will crack down on unsafe behaviour by members of the public as it tries to maintain control of the crisis, with plans to develop a rapid antigen testing regime in schools likely to be intensified, though you're not going to see that for weeks. By the way, so it can't be that desperate if that's going to take weeks, can it? I say that with my tongue in my cheek, of course. It's also planning to extend COVID cert rules to gyms, hairdressers and barbers. What do you think about that? Speaking to people out and about, there's a mixture of views, but I think there's quite a bit of fear out there. People are making decisions. They are cancelling events or not going to events, or, they are making their own personal decisions as it relates to what they do and don't do. COVID certs are, it's patchy. They're enforcement, I suppose. But the government's considering introducing them for gyms, hairdressers and barbers. Would that make you feel safer, or would you feel it's a further infringement on your rights and it would make you cross? We want to hear from both. 08660 25,000. It's what's going to happen is they're going to tell people to work from home as much as is possible, which has an impact on society in terms of, people eating out in cafes at lunchtime or shopping or what have you. Micheál Martin said the reopening of society has increased the spread of the Delta variant, which has in turn led to rising hospitalisation numbers. We have to be very mindful of that, and we can never rule out having to take measures to reduce that impact, he said. So in Austria, for example, they're in other parts of Europe, they're reintroducing lockdown measures. In parts in Austria, they've introduced lockdowns for the unvaccinated. In Germany, their language is, this is now a pandemic of the unvaccinated. That's what we're seeing in other parts of Europe. Does that mean that's what's next here? Is it something that you would like to see? I don't know. The majority, almost 93% of adults are already vaccinated. So perhaps a measure like that wouldn't be required here, would it? Because I think people have made up their minds for the most part now whether or not they're going to get a vaccine. But we shall see. The Irish Daily Star tells us that a surge in support for Sinn Féin has put the party 16 points clear of their nearest rivals, according to a new poll. Sinn Féin are the country's most popular party on 37%, ahead of Fine Gael on 21% and Fianna Fáil on 20%. A behaviour and attitude survey for the Sunday Times has shown the Green Party was on 5 points. You'd think they'd get a bounce with what's happening in Glasgow if people were making a link between the Greens and the Green Agenda and COP26, but seemingly, I mean, if you plus or minus, it's what, 3 or 4%. Statistically, they could be down at 2%, but conversely, they could be up at 9 too, I suppose. The Green Party are on 5 points. Labour and the Social Democrats are tied on 3%, while Solidarity, People Before Profit and Aontú have 1% each. Sinn Féin have risen 6 percentage points since the previous poll. Fine Gael are unchanged. I nearly said unhinged. Fine Gael are unchanged, and support for Fianna Fáil has dropped by 3 points. So is it something that Sinn Féin are doing, or is it what the government's doing, I wonder? 086 60 25,000. I don't know. Think this will. It's not something we talk about, but I think it's something we talk about a lot amongst ourselves, perhaps. And that's the problem of drugs in this country. And maybe people thought previously it was an urban problem. It's not. It's everywhere. Cocaine is readily available, and lots of our young people are taking drugs because it's as accessible almost as booze. And it's cheaper, and, it's just happening. Kids as young as 13, we're reading in The Sun, are addicted to cocaine as Ireland's drug problem spirals out of control. Their special investigation, exposes how addiction services struggle to cope. As TDs say, coke is now devastating rural towns and villages. I'm not even going to ask, is it the case? It is the case. We know it's the case, don't we? Do you want to talk about it? 086 60 25,000. Are you a parent of a young person? How worried are you about what's going on? Let us know. Let us have the conversation. Call Caroline on 07491 25,000. The Irish Daily Mirror now. And finally, the importation of peat to Ireland does not make environmental, economical or ethical sense. An independent report has warned we didn't need an independent report. We've been talking about it on programmes like this for ages. It doesn't make any sense seeing this peat being shipped hundreds of miles to come in here. Crazy stuff. It recommends the government ends this practice and indicates that our own production could be partially revived to assist the horticultural sector. The report from the working group, which was chaired by Dr. Munu Prasad, was submitted to the Department of Housing, Local Government and Heritage on October 20th. It warns that the department, a continued supply of Irish peat to the professional horticultural sector in Ireland is essential, at least in the short term, and preferably from Irish bogs in order to allow adequate time to research alternative growing media is the word they use. I would have thought it should have said methods, but anyway. 086 60 25,000. That's your WhatsApps and texts. 086 60 25,000. Get involved in the conversation.
The newspapers are courtesy of Kelly Centra, Mountaintop, Letterkenny. Today's 9 till noon show is brought to you in association with Ulster Tyres. Are your tyres ready for winter? Call into Ulster Tyres in Letterkenny and Ballybuffet today.
Zero. It gets a bad rep. Like when people say they have zero interest in something. Well, if you're thinking of buying an electric car this year, you'll find this interesting because at Nissan we see the power of zero. Introducing the Nissan Leaf Power of Zero offer. Buy a brand new 100% electric zero emissions Nissan Leaf and get 1 year's free servicing, a free home charger, the lowest electric finance offer on the market, and great savings on running costs. Now that's the power of zero. Find out more at nissan.ie.
the smallest shrub to the largest tree in an awkward place, Donnelly Tree Services provide a complete range of tree surgery services. Whether you need to remove a dangerous tree or some nuisance branches, Donnelly Tree Services have the experience and expertise to carry out tree surgery to the highest of professional standards. Call 083 005 9939. Donnelly Tree Services, Donegal. No job is too small, no tree is too tall.
Central Auto Parts really do stock everything for all makes and models of cars. Shocks, springs, wipers, mats, brakes. Need I go on? And now stocking Celimix and Sunny Car and Commercial Paint. Central Auto Parts, Portlink Road Business Park, Letterkenny. Find us on Facebook or call us on 074 9127 491.
Candles, lanterns, Christmas trees, decorations and all types of lights. Everything you need for Christmas. Experience the magic of Christmas at Cooney's. Our biggest and best Christmas shop has outstanding value on lights and trees. There really is something for everyone at Cooney's Letterkenny Retail Park.
Applications are now open for the Donegal Enterprise Awards, hosted by Local Enterprise Office Donegal. The awards celebrate the diversity and strength of the small business community in Donegal and the role they play in our local economy. A prize fund of €12,000 will be awarded across 7 different categories. This is an excellent opportunity to promote and showcase your businesses. All finalists will be profiled and attend the award ceremony in December. Apply before the 15th of November at localenterprise.ie/Donegal. Email info@leo.donegalcoco.ie for more information or call the local enterprise office on 9160735.
At Letterkenny Shopping Centre, we're already dreaming about the festive season, so why not make a start? Park for free and enjoy your Christmas shopping this year. Letterkenny Shopping Centre, bringing you the time at
19 minutes past 9. Now, 2 emails sent by housing authority officials in error to people living in Micah homes show the disdain the Department of Housing officials has for those affected, residents claim. In one email, Principal Officer Paul Benson, who's been taking part in the discussions on how to address the scandal, which has seen thousands of homes crumble due to defective building blocks, accused a Micah campaigner of wanting to cause a scene. The emails were meant for his colleagues, but instead were sent to Micah homeowners, Department officials and Housing Minister Darragh O'Brien in recent weeks. As a decision on how to solve the Micah issue is delayed again, talks between the government and affected residents in Donegal and Mayo have at times been anything but cordial, critics say. I'm reading here from a newspaper article. It's understood family reps taking part in the working group have told the coalition that the engagement since the start has been continuously thwarted and stymied. Right, so in this email, it appeared to criticise Donegal rep Eileen Doherty. She just wants to cause a scene, saying we have misrepresented their submissions, he wrote. You can reply and tell her that we will not use the summary but include their full PowerPoint presentation in any documentation going forward to Minister O'Brien. Mr. Benson told colleagues. Well, the named individual, Eileen Doherty, a long-time Micah campaigner now, has joined us on the programme now. Eileen, thanks. I suppose in a way, isn't it good that we're getting to see this? We're getting to see their attitude, that the curtain's pulled back, and we're getting to see what kind of operators these people are.
Absolutely, yes. Good morning, Greg. Yes, absolutely useful to see. And so those emails were sent actually a while back. They were sent around the time of as they were concluding the actual report from the working group, and they sent those emails in error to. Actually, they sent that one particular in error to me. So it was interesting to see what they were saying behind the scenes. And the context of that basically was that for about a week, we had been asking for a copy of the draft report, which was going to be a combination of the work that we all as a working group had worked on over the summer. And I repeatedly kept asking on behalf of the family representatives to get visibility on the report for us to review it before we could sign off on it. And they kept refusing to send it. So that was a day before the final meeting with Minister O'Brien. And basically I sent another email saying, given that you haven't sent us a copy of the draft report, then I assume you will understand we won't be signing off on the report. And that was the response. So basically they had no intentions of showing us the draft report, and that was a response from Paul Benson to his colleagues. She just wants to cause a scene tomorrow when Minister O'Brien was in the meeting, which in actual fact we didn't even mention it. But just a couple of hours before the meeting, I did reply and copied all of the rest of them into his email to say, I assume you meant to send this to someone else. So,
did he reply?
He didn't. No, he didn't reply at all. He ignored it. He didn't reply and he didn't apologise.
Right. No apology.
No apology, nothing. No, just to pretend it didn't happen.
Okay. Buried the head in the sand. So, like, what do you... I mean, you've kind of outlined it there, but what do you think this tells us about their attitude to this process?
Well, I think what it clearly tells us about the attitude of the process, which we actually, to be honest with you, we worked out quite a lot during the summer, was that for a lot of the officials, there was never the intention of actually finding a solution. That I think they just wanted to say that they've ticked the box, that they'd gone into this process and tried to work meaningfully with us, which in actual fact they definitely did not. Now, the exception to that is that in August we worked closely with the housing agency, with John O'Connor, who was the chief executive at the time, and his colleagues. Now, that was very meaningful and very valuable engagement, and they really gave us very good advice and worked closely with us to help quantify the costs for rebuild and stuff like that. So there were exceptions, and he was probably about the only exception on the working group, to be honest. He now is actually working with Minister O'Brien closely and us, and trying to broker a deal really between all of the parties. So there was exceptions, but the majority of the people who were in the working group, I think, did not intend or have any intention to try and find solutions, but it was a pity. But in saying all of that, there was a lot of value that we got out of it, because it actually kind of forced us as a working group to actually quantify and to really put down on paper and articulate very in great detail what we meant the requirements were from families. So the process was valuable, but the actual engagement was very difficult.
We wrote to the department looking for a statement as it relates to the emails that they sent out to you. This is how it reads. I'm not sure, it's not very satisfying. I don't know, I've only glanced over it. There's no spokesperson available, they say. Government are acutely aware of the urgency of this matter and want a scheme that works for people who are right now watching their homes crumble. The issue is being treated with the utmost priority, and proposals in relation to enhancements to the current scheme will be brought forward as quickly as possible. A working group was established earlier in the summer to address the concerns of affected homeowners in relation to the existing scheme. The group met on numerous occasions. Importantly, progress was made on a number of issues. The government acknowledges that the current scheme is not working as it was intended, and significant enhancements will be made. Minister O'Brien is continuing to engage with the coalition party leaders and Minister for Public Expenditure and Minister for Finance to agree significant enhancements, and these discussions will continue this week. The government want to help affected homeowners and want a scheme which works for them. So it doesn't reference at all it's a reaffirmation, I suppose, of something of a commitment, but it doesn't, unfortunately, as we requested, it doesn't reference the emails sent by that gentleman that happened to end up in your inbox. Right, okay. What do you think about that, Eileen? Not surprising, perhaps.
Well, it's not surprising, to be fair. I mean, the emails and that did come from the officials as opposed to the politicians. And I suppose what we're hearing behind the scenes is that apparently Minister O'Brien is pretty supportive of our position. And I think that the campaign has worked in that raising awareness and the difficulties families are going through. But, the one thing I would say is that, it shows a lesson. And we've spoken to other people who reached out to us, the people who were campaigning for the mother and baby homes, for example. They reached out to us over the summer and told us that they had a terrible experience too with officials. So it would seem that this is not unusual, that this is almost, these people are gatekeepers, and I think they try to wear the group down. So, when we went into it, I think you go in, and we said this in the working group, we went in with a spirit of trying to find a solution, and there was certainly no sense of trying to find a solution from the officials. They definitely were always...
They're like a firewall almost to filibuster and to frustrate a process, but obviously that wasn't going to be allowed to happen, because to some extent we've been down this road before, so a lot of lessons have been learned. This whole process, though, I think has been incredibly valuable, hopefully from the MICA perspective, because that's what it's all about, but in exposing what goes on, how governments work, how the permanent government operates, who is the power, who pulls the strings, their attitudes towards certain things. I think many people may have already known what's going on, but I think this has opened up this to the general wider public, and I think it needs changing. The whole system needs looking at, because this is no way to run a country.
It's not. And the one thing I will say, Greg, is that because we've been in this process for so long, like 8 years, and I know one's 10 years, for example, you know, we kind of had come up against a lot of opposition to a scheme for years and years and years. So in one sense, we were kind of well versed in this process. By the time we got to that working group, a lot of the opposition to anything we said was not new to us. And I think there was a kind of an element of surprise too, if I'm honest, with officials, because I think if they thought they were coming up against a team of kind of novices, I suppose, who weren't willing to sort of be challenge them and stuff, well, then they were very mistaken. And I think that sort of shows in that tone of that email too. She just wanted to cause a scene, because we didn't accept everything they said in the meetings. We did challenge them. We did always fight back and say that's just not good enough. So I think that was what it was. I also read between the lines in those kind of emails too. So the process was definitely worth it. What we came up with in the end in terms of the output. I mean, I've been speaking to people within the department the last few weeks, and they told me that we came up with a spreadsheet in the end which had all of the issues and the current stance and also potential solutions for everything in great detail. And I've been told that the department are using that a lot as they're discussing the actual final revised scheme. So very valuable process, but very difficult all the same.
All right, what is the time frame now, Eileen? I mean, I know the indications are that Darragh O'Brien is batting for the families, but we just don't know until such time as whatever they decide is made public. But what is the time frame as it stands now in terms of when we can expect to hear something?
The time frame as it stands is a week tomorrow. We hope to have a good cabinet, and an announcement should be made on that day. That's our current time frame. We'll be touching base with people within the department this week to see if there's any change, but that's the time frame that we're working towards at the minute. The other thing that might be worth noting, Greg, is that there's 22 of us actually are going to Brussels on the 30th of November.
Yeah.
So we're going to present.
Tell us about that. It is significant. I know it's been reported, but you know it's still well worth going over again. It's not insignificant, to say the least. So what's happening then at the end of November? Who are you meeting? Who are you speaking to?
Okay, so what's happening at the end of November is we're actually presenting on the 1st of December in Brussels and the European Parliament. Joe Morgan from Letterkenny coordinated about 8 petitions over the course of summer, and basically what happens is there's a process within the European Parliament which is the Petitions Committee, and basically you submit petitions as an EU member state or an EU member, let's say, and you based on non-adherence to EU legislation that exists. So basically these petitions are a way of saying to the EU, look, Ireland has not abided by legislation that you have set up, and as a member state they're obliged to do that. So we get now to go, those petitions were submitted, and we go in front of the EU Petitions Committee and the European Parliament on the 1st of December to make a case for them to go back to the Irish government and say, you actually rightly, your citizens have rightly come and put a case forward, and we need you to fix this issue. So it's about the fact that they allowed concrete products to go into the market in Ireland and not have proper governance and oversight, and that as a result we've got this catastrophe. So this is a way of shining a light on basically what the Irish government should have done 10 years ago.
Maybe should be doing now. I mean, they
should be doing now.
Is the governance there now? I wonder. All right, Eileen, we'll be speaking obviously before the end of November, but we'll be covering, of course, that trip to Brussels. Thanks for your time, Eileen. Appreciate it.
No worries.
All right, take care. Bye-bye. Eileen Doherty there, Micah campaigner, 086 60 25 000. That is the WhatsApp or text number. Call 07491 25,000.
Today's 9 till noon show is brought to you in association with Ulster Tyres. Winter is coming. Get your tyres winter ready. Call in to Ulster Tyres in Letterkenny and Ballybuffet today.
Letterkenny Shopping Centre is where real Christmas begins. Get everything you need for the festive season with a wide range of gifts, food and services. Park for free, have a browse, grab a coffee and actually enjoy your Christmas shopping this year. Thank you for visiting Letterkenny Shopping Centre this Christmas.
Bank of Ireland is looking out for your financial well-being. They want to help protect you from fraud. So whether it's Black Friday, Cyber Monday or even just plain old Tuesday, be careful online. Don't assume that every text message or email you get claiming to be from a bank, a delivery service, or any company is legit. And remember, Bank of Ireland will never send you a text message or an email with a link asking for your full 365 PIN number or one-time passcodes, so don't give them out. Search Bank of Ireland Security, and together this Christmas we won't let the fraudsters win.
Begin. Bank of Ireland is regulated by the Central Bank of Ireland.
Calling all brides-to-be. McElhenney's early Black Friday bridal sale has just been announced, with up to 70% off selected designer gowns in store for 1 week only from the 15th of November. Book your appointment today. Call 074 91 31217 and find your happily ever after dress at McElhenney's Bridal Rooms.
Live electricity wires are always near, and coming close to them can be dangerous. So always ask yourself, are you sure it's safe? Look out for electricity wires above and below you. If in doubt, call us on 1800 372 999. It might just save your life. ESB Networks. Stay safe and stay clear of electricity wires.
Fabulous fabrics in stock for Christmas at Fabric World Maydown. Thousands of ready-made and made-to-measure curtains available at amazing prices, on trend and in stock. Now official stockist for Laura Ashley. Call in for a quotation to Fabric World Derry. Great Euro rates.
Make your next menswear choice at Watson Menswear Letterkenny. From suits to casual wear, there's big names like Rimassimo, Superdry, Penguin and Tommy Bow. If you're getting married, call in for an appointment and get fitted in style. That's Watson Menswear, open 7 days a week on Main Street in Letterkenny, or online at watsonmenswear.com, or follow on social media for more details on offers and new arrivals. Christmas Club now open.
Now, concerns have been expressed with how new COVID-19 regulations surrounding visits to nursing homes will impact facilities in the Northwest. People visiting nursing homes now need to show a digital COVID-19 cert. New HSE guidance will require proof of vaccination or immunity at the entrance. It's still unsure whether UK certs will be accepted by nursing homes. This is, of course, expected to be particularly problematic for nursing homes in this region. Anne Gallagher is owner of Hillcrest Nursing Home in Letterkenny. Anne, thank you for joining us.
Good morning, Greg.
Do we have any update as to what the situation is for people maybe travelling over from Britain or in from Northern Ireland with a UK cert? Is that acceptable for access to nursing homes?
Well, in the first instance, they need to show that they have COVID immunity. The majority of our visitors to our nursing home certainly will have had their COVID vaccinations, and indeed many of them will have their boosters at this stage. So I certainly haven't had any problem. We have always been asking people when they were visiting whether or not they have COVID vaccination, and 99% of the visitors have had vaccination and are well up to date with their vaccination and their vaccination status.
So is it a case really that this is guidance that's catching up with predominantly what's already been happening on the ground?
Yeah, absolutely.
Okay, so you don't
Absolutely.
really anticipate it then being excluding many people?
I've never excluded anyone from visiting a parent or a relative.
No,
and
not
I'm not
you.
going to start now.
I know, not you. I'm saying, do you?
Yeah.
I know you
No,
don't.
no,
I'm saying, do you think the
Well, I don't know.
regulations will exclude people?
The regulations, I can't imagine that they will, but I think that nationally the rules have been applied. You know, they haven't been applied evenly across the country, so I don't know what's going to happen. But certainly for my own nursing home, we never have and never will turn anyone away. We will always facilitate relatives. But this issue, the idea that UK or Northern Ireland's Q codes wouldn't be acceptable, to me, that's a nonsense.
Yeah, it might be one of those stories where people try and look for where the problems might lie rather than the actual. Because I think a lot of this actually has been driven by, and this is nothing, not been suggested, of course, about your nursing home or any that I know of, is that some nursing homes aren't being careful enough, and it's actually families that have been sort of driving these changes as much as the governmental method or the HSE themselves.
Oh, you couldn't be careful enough, and I don't know that there's any wall that you could ever build that would keep this virus out. But, and, you know, absolutely every measure that we can take, we will take, as will our staff, our residents themselves, and people coming in to visit the nursing home.
The boosters have been pretty much rolled out, I think, you know, in the higher age groups and now with over 60s. In terms of your staff, where are they in the, just call it a queue for the sake of it, where are they in the queue for boosters?
Many of our staff have already had our boosters.
Mm-hmm.
They're currently administering the boosters to staff. So we're very lucky that the vaccination centre is just across on the other side of the high road.
Mm-hmm.
And so the staff have been nipping over just to get their booster. I'd say that 50 to 60% of our staff have already had their boosters.
Obviously, you care and home people, many people that would be in the more at-risk categories. Do you get a sense of that the vaccine has offered protection, that it has saved people catching COVID?
There is no doubt in my mind that it has. We certainly have. We had a small outbreak recently. I'll rephrase that. We had a few residents who tested positive recently, maybe September, October.
Mm-hmm.
But other than that, they had positive swab results. You wouldn't have known that they had COVID.
Okay. And how often are people tested now in that setting, Anne?
They were only being tested. We only tested those people because we had reason to test them.
Yeah.
We had one or two people who presented with just head colds,
Mm-hmm.
and we just thought, just to be sure, we tested them, and actually were surprised that they had COVID. But these were people in the very vulnerable age group, but they were, they were asymptomatic,
Mm-hmm.
positive.
Which is good news. It didn't affect them. So what is your, heading into the winter, we're in it, heading autumn into winter now, is it a nervy time, Anne?
Very, very, very scared. Because, and the main concern is that, staff will undoubtedly contract COVID and will have to stay off duty, and it's very difficult to cover in the event that we have staff shortages. It's very difficult to cover. But and that said, the vast majority of our staff are double and triple vaccinated and have, without a doubt, followed the guidelines for the last, can't even remember how long we're in this now, almost 2 years. And so, we've managed before and we'll manage again.
It's a big pressure on these people, a big responsibility. I suppose every birthday, every wedding, every invite has to be mulled over and assessed, and because it's not just themselves that they feel they are.
Yeah, really, really considering things very, very carefully. The staff have lost, a very big proportion of our staff would be, it doesn't make any difference what people are, but a lot of them are younger people who like going out, like going to nightclubs, like going to the pubs, and honestly, they in the main haven't been doing so. Had they been doing so, I fear that we would have had more COVID in Hillcrest than we have had, and we haven't. So. But it is becoming more difficult.
And of course, when you see cases going up, and maybe if you're keeping a particular eye on the Letterkenny LEA, you start wondering, well, the more if it's out there, the more risk it is to the people that live with us. A caller says, do I have the right to ask the person asking for vaccination proof if they've been vaccinated? And you don't have any right to that.
Well, you can ask. You mightn't get an answer, but you can ask.
Okay. Right.
If they come to Hillcrest, they can be sure that whoever's asking them will have been vaccinated. So.
Yeah, there's that still head knocking, I mean, and when you read things like that there, people trying to in some way undermine the vaccination program, whatever, they might have their own deep set views in relation to that. As someone who operates in the business of caring for people primarily vulnerable, what emotion does that trigger in you, if any?
Oh, you just move on.
Okay. Anne, thanks for your time this morning.
Thanks, Greg.
All right, have
Be
a good
safe.
You too. Take care. 086 60 25,000. Anne Gallagher there, owner of Hillcrest Nursing Home in Letterkenny. Hi, Greg. I need to review my medical card. I've tried to contact the HSE, but the phone number is not in use. Could you please find out what the number is? Thanks so much. 086 60 25,000. What is the number? You're always very good in that. A person needs to review their medical card. What number do they contact locally? 086 60 25,000.
Today's 9 till noon show is brought to you in association with Ulster Tyres. Are your tyres ready for winter? Call into Ulster Tyres in Letterkenny and Ballybuffet today.
Buy a ticket. Buy a ticket in Highland Radio's mega draw to win a car. Get your ticket by November 30th and automatically enter an extra draw before the big draw. Big draw. One lucky winner will walk away with €2,000. Imagine, that's Christmas all wrapped up. Christmas sorted. The draw will take place on Wednesday, December 1st on the 9 till noon show. 9 till noon. And you're still in with a chance to win the Kia Exceed worth over €28,000. 28 grand.
It's that simple to win that car.
To get your ticket, log on to highlandradio.com. Highland Radio, exceeding your expectations.
Ooh. Ah, the difference fragrance makes in a woman.
Give the gift of designer perfume this Christmas from McGee's Chemist, Letterkenny.
Choose from Clarins, Flower Bomb, Gucci, Calvin Klein and Burberry, Yves Saint Laurent, Jean-Paul Gaultier and Elizabeth Arden.
Evocative, alluring, sensual.
What is there about this woman that turns everyone's head?
The perfect gift at the perfect price. Designer perfume from McGee's Chemist, Main Street, Letterkenny.
Do you need a little extra help staying in your home? At Bluebird Care, we offer a wide variety of QMark-approved personalised home care services across Donegal. And our fully trained and committed staff will always meet your care needs with kindness, compassion and dignity. To get your personal home care assessment plan, visit bluebirdcare.ie or call our care team today on 07491 29562 and bring care home.
Nevin Maguire here, and I love this time of year. It's a great time to try out new recipes for the big day. It'll come as no surprise that I think cookware makes a great Christmas gift. And my Cook with Nevin Maguire range at Dunnes Stores has plenty to choose from. You'll find lots of great gift ideas, from colourful cast iron pots to the versatile skillet pan, as well as great kitchen gadgets. Shop the Cook with Nevin Maguire range at Dunnes Stores today, in-store or online.
Highland Radio weather updates with National Fuels Letterkenny. For a keen price on your home heating oil, call National Fuels on 9137 400.
Okay, the weather forecast. I'll just get this up for you now, and I can tell you that a cloudy start with patchy rain and drizzle, clearing drier afterwards, with lingering mist and fog slowly lifting, becoming generally dry and bright by afternoon with spells of sunshine, temperatures of 9 to 12 degrees. Now, Aintu have been inquiring in the Dáil as it relates to children in state care, and figures that they were given show that 42 children died in state care over the last 10 years. The Aintu representative for Letterkenny is Mary T. Sweeney, and she joins us on the programme now. Thanks for joining us, Mary T., and tell us about these figures and how they were acquired.
Good morning, Greg. Good morning, listeners. Well, really, they're harrowing statistics. It's difficult to believe that over a 9-year period, some 206 children have died while they were directly either in state care or indirectly the state was aware of them. So of them, there were 42 children who died, and of that, 18 died either as a result of suicide, and you were talking earlier, or drug overdose. One was murdered, a very famous case, or infamous case in 2010. And it's absolutely horrific to think of. 1 year alone, there were 7 deaths, and 5 was the next highest. But it's been quite difficult to get exact details from the state to say specifically which regionally where these children died. It's a 2010 case with the murder that happened then. But to think that 42 people, children in total in the care of the state have died, and especially to consider that what help is available for them with suicide or with counselling, with mental health issues, or with addiction to whatever drugs they were taking. I think it's unacceptable. We need to investigate this further. You know.
And what specific questions do you have? Why do you feel it's important to have a county by county breakdown?
Well, then you can target specifically what needs to be put in place to address the issues. And you mentioned in the programme earlier, we are all aware of the significant drug condition that's happening from the secondary schools on. And there has to be something put in place directly linked to the schools to get a better information programme and a better support network. But at the moment, the support networks are failing us across the board.
And do you feel it questions the level of state care? Do you think more information needs to be provided so, we can determine what level of intervention or what action was taken in specific circumstances by the state?
I think the figures speak for themselves. It's shocking to think that 42 children have died while in the care of the state. Now, they have not provided any information on the 164 children that they were aware of that have been reported to the Child Protection Services, but we have no details on what intervention or why they weren't brought onto the net and why they didn't get support. That would be crucial to find out that type of information.
So there were 25 young people that died in care, 17 in aftercare, 17 by natural causes, 1 homicide, as you mentioned, 12 suicides, 6 drug overdoses, road traffic collisions accounted for 4 deaths, other accidents, as they described, accounting for a further 2, that bringing the total to 42.
The reality is that 17 children died from natural causes. And there's no clarity or definition. We do need to know what has been neglected here, what could be put in place. Was there services missing? Was there support groups missing? And these are questions. Now, I'm aware of situations even in Donegal of young people that have relayed stories to me about their experience in care. And not all stories are very happy in this day and age currently. So we need to be made aware of these, and we need a system in place that's going to pick up and not let children fall through the cracks. We really need to try and put a better support network in place.
Yeah, and it would be useful, I think, to know too, from what population of children are these figures relating to? Do you know, over the period of 10 years, how many children would be classed as being in care, and then how does that compare to the sad loss of life in under 18s in the general population? I think that would be useful too to know that, wouldn't it?
Totally. And with the history of suicides in Donegal, it's very pertinent, and especially often with our young male population. But another area for me that highlighted concern for me was the fact that over the last 5 years, there were the number of children going into state care is falling by over 200 this last 2 years in particular, when I would have thought that would have been a very stressful period. And it would make me question if there had been, in that 9-year period where we have figures, 164 children who died, who had been highlighted to state services, but they hadn't been brought in under the network, then how many children are not being taken into the net that should have been taken in and given protection and assistance and support, even though the system that was supposed to support them here has obviously failed?
Well, one of the reasons, because we're talking numbers under 5 per county, you would imagine maybe areas of large population might have more in terms of the figures. It is across the board, because we've seen it with COVID cases, how they're reported. One of the arguments TUSLA gave for not giving a breakdown was to protect confidentiality, to maintain confidentiality. Do you believe that to be a satisfactory explanation?
Absolutely not. How can you put a network with the teams on the ground? I know teams at CAMHS, from my experience, have been overrun. There's just not enough qualified people there working in the services. Mental health is a disgrace at the moment. And I do hope that, I know so many young people that are living on their own in apartments or in flats, in situations where they are still very, very vulnerable. And, what horrified me was I was listening to the government.ie during the week, the report by Anne Rabbitte in relation to the Grace case. And the report there started 4 years ago. Over 7 million has been spent on that report. And yet, Greg, it's missed all the deadlines for completion. How many children, could have benefited from an efficient, well-conducted report that was going to give real support to the networks in the south and across the country, as we've seen in Donegal.
If that analysis were in some way to make sure that something like that could never, ever happen again, to be a blueprint to ensure that every child is absolutely protected as much as we can, it might be multiples of million well spent. But if it's a document that's not accessible or sitting on a shelf or not acted upon, truly is. I mean, obviously it's important to get to the bottom of these answers, but that money, as I think, which is what you're saying, could have been better spent on improving the services for people, because that million would go an awful long way in the areas that we're talking about, because a lot of it's just people, employing people and giving people appointments. We've seen the desperate situations where we found 15 or 16-year-olds having to go onto social media crying out for an appointment with some of these services just to try and get themselves better.
That's absolutely what I'm finding on the ground. And some of the services aren't too happy when you phone up to try and intervene to give support to people that are not in a position that they're really well. When you're sick, you're not well able to represent yourself. You do need support, and again, in my experience, there's been a lack of support from mental health in the community. We don't have enough well-qualified community health, mental health nurses, advanced nurses going out that can give very specific help, or should it be medication changes or should it be reviews? If we don't have the doctors, then we're going to have to provide more advanced nurses that are specialists in their field that can go out into the community and have power, but they need power and they need to be, well qualified but with power to be able to identify and interact immediately when they see. I have some crisis cases that I'm aware of across the county, and if we don't do something, there's nobody going to do it.
Yeah, and I mean, there's a line has to be walked as it relates to confidentiality and all of that. I do get that, but that either can't be used to mask a problem or to stop us having a conversation about it, or to see, let us have access to what's going on so that we can put the pressure where it's required to improve it. You know what I mean? We can't have everything in secret, and then it's very hard to get to the bottom of things, to try and get resolutions, to try and get improvements.
I'm aware of one case that without specifics, one young lady that had over 10 suicide attempts in 4 years, and the family were having to scream to get help. It's just not acceptable.
They'd be absolutely desperate. I know that myself from contacts we have here. It's heartbreaking because the parents feel helpless and they're not getting any help themselves either, and it's a terrible, terrible situation. Thanks for coming on, Mary T, to discuss this with us. I know your party's continuing making inquiries in this regard, and perhaps we'll talk again in the future.
And if anybody has concerns or needs to come forward, they want Peadar Dubin to bring this forward in the Dáil to try and get them support, please, I would invite them to come forward to contact me. I'll do all we can.
All right, thanks. Mary T. Sweeney there, Aintree representative in Donegal, 086 60 25 000. That's the WhatsApp text number. Give us a call on 074 91 25 000, 074 91 25 000. Hi, Greg. I just wonder, do people realise or really care about the failure of the climate plan? According to Mary Robinson, it was a failure, thanks. I think it was a qualified failure. I think she was very disappointed as it relates to the watering down of commitments as it relates to coal and what have you. I think from listening to the same interview, I think there's quite a lot in there that she thought was quite positive. Is it an absolute failure or the best that could be achieved? I don't know. Greg, re-COVID, it's all about money in the tills and nothing is going to happen before Christmas or after. I don't anticipate it, to be honest with you, but we shall see. Who's to say? If you work from home, help caring for the elderly. It's hard to work from home. Yeah, I know what you're saying. Hi, Greg. Would someone please explain what's the difference between a person who is vaccinated for 6 to 9 months now and a person who is unvaccinated? The only difference I see is the vaccinated still can get the venues. Oh, sorry, can still get into venues, and the unvaccinated can't. For the majority of the population, they say that people vaccinated after 6 months, as I say, the general population, the general, younger, healthier population, they still have adequate protection. I don't know. I can't see that. Those restrictions easing. I can see them getting tougher if they're going to be going in any direction. Fianna Fáil Minister Darragh O'Brien, Principal Officer mask has slipped. Eileen is correct that the department, are trying to wear them down. Usual government tactics to suppress action groups. We saw it used with hospital downgrading, Garda station, banks and post office closures. Perhaps, but I don't think this is something that the Micah Action Group and those supporting them and Paddy Differ, etc., are going to be ground down by these people. Let's put it like that. Right, we'll be back with much more in the show after the news and obituary notices. Stay where you are, and as I say, chat to you in about, just after 10.
Today's 9 till noon show is brought to you in association with Ulster Tyres. Get your tyres ready for winter. Call in to Ulster Tyres in Letterkenny and Ballybuffet today.
Show your appreciation for Donegal business this Christmas with Buy Donegal. Visit buydonegal.com to see a host of participating businesses and special offers to start your shopping list. To get involved, buy a product or service from a Donegal business and share on social media. Buy Donegal takes place from the 5th of November to the 31st of December. For more, visit buydonegal.com.
Sheridan Security, now introducing Zero Wire Smart Alarm Systems. Zero wire, zero mess, and a real peace of mind. With a simple press of a button, your alarm can be set or unset, or download the free app and control it from your phone. Call us today on 074 912 6025 and get your alarm from €299. Stay local, stay safe, and protect what you value most with Sheridan Security Systems.
Beat the cost of Brexit and no customs charges. Do you need a UK address? For your limited company or personal use, Space Hub in Derry can provide you with your own virtual office or mailbox. Have your post and parcels delivered to Space Hub and collect at your convenience. Also brand new 20-foot shipping containers now in stock. Ideal for all your storage needs at our Springtown and Coolmore depots. Find us on Facebook or spacehubderry.com or call 04871 878077 for details.
You can pick up all the ingredients for a great Black Friday deal at Tesco Mobile, like the Samsung Galaxy A52s 5G, free for just €30 a month on our bill pay plan. That's a saving of $149.99. Plus, you'll even get 99% network coverage. This is Supermarket Mobile. Visit us in-store or search Tesco Mobile. Every little helps. T's and C's apply. 24-month contract payable by direct debit. 99% population coverage. See tescomobile.ie for full plan details and T's and C's.
As more sectors across Ireland are reopening, the COVID-19 pandemic unemployment payment is changing. If you're currently receiving this payment, the amount you receive will change from the 16th of November. To find out more about how these changes will affect you, visit gov.ie/PUP changes. A Government of Ireland initiative brought to you by the Department of Social Protection.
The big Christmas lights switch on in Letterkenny is this Friday, the 19th. From 6:30, there's entertainment on the stage at Market Square, treats from businesses along Main Street, the big switch on, and then the arrival of Santa on his sleigh. It's a great evening for all the family this Friday at the Letterkenny Christmas Lights Switch On. See the Shop LK socials for details.
Live, on air, online, and on the Highland Radio app. This is Highland Radio News.
Good morning, it's 10 o'clock. Donald Kavanagh at the news desk. The Cabinet Subcommittee on COVID-19 meets this evening to consider what action needs to be taken to tackle the escalating COVID cases. The wider use of vaccine certs, antigen tests and working from home are all up for discussion. 596 people were in hospital last night with COVID, 106 of them in ICU. At Letterkenny University Hospital there were 19 COVID patients, none of them in intensive care. Professor Sam McConkey from the Royal College of Surgeons says while vaccines are protecting against against serious disease, they're not very effective at protecting against transmission.
What we're finding is that this vaccine, Jane, is more of a vaccine against disease and severe disease and death than a vaccine against transmission. So it doesn't really, this particular vaccine, going intramuscularly, it doesn't provide sort of immunity in your nose to stop you catching it and unfortunately stop you passing it on to the people around you, as well as it does to prevent disease and death.
The HSE says the healthcare system is overheated and under serious pressure. Chief Clinical Officer Dr. Colm Henry says staff had to provide critical care outside ICU settings over the weekend.
We've seen our intensive care units, particularly in the Dublin region under serious pressure, no doubt about that, having to cancel other operations and having to exchange patients between hospital and having to provide a form of intensive care outside intensive care settings too.
A member of the Micah Action Group says comments made about her in a Department of Housing email were disappointing. Over the weekend, the Independent published details of emails sent by Housing Department officials regarding defective block working group meetings. One such email was mistakenly sent to Micah campaigners in the working group, describing campaigner Eileen Doherty as wanting to cause a scene. She says it shows a fundamental lack of respect.
Well, obviously we are very, very disappointed at the very unprofessional manner in which the Department of Housing officials really viewed the family representatives from both Donegal and Mayo and the working group. We're very disappointed. Really, we entered into those talks with a very sincere intention to find a solution to the Micah crisis, and it's pretty apparent from those emails that the department officials did not have the same perspective in mind. They did not enter into those talks, with showing us respect and really in a professional and transparent manner. So it's very disappointing.
A 30-year-old man has been arrested on suspicion of arson following a fire in the Rathmore Road area of Derry in the early hours of this morning. There was no one in the building at the time. Police say the blaze, which was reported at 12:30, was tackled by the Northern Ireland Fire and Rescue Service. It's emerged that the car park at Glenveigh National Park reached full capacity on 24 occasions this year, meaning cars were being turned away at the gates. After getting the statistics in answer to a Dáil question, Donegal TD Pearse Doherty says that urgent action must be taken to ensure that locals and those who wish to visit the park are accommodated. Minister Darragh O'Brien told him in a draft visitor experience development and management plan is being drawn up. Deputy Doherty says that's to be welcomed, but must be progressed speedily.
It's good that there is a wider plan for Glenveigh National Park, and it goes way beyond, obviously, the car parking facilities. What we now need to hear from the Minister is when is that going to happen? While Glenveigh National Park remains open, it's no point being open if people can't get out of the car and experience what is an asset here in Donegal. So we do need to hear from the Minister in terms of the time frames for expanding that car park capacity, and crucially we need to have some interim solution before the peak of next year's season.
And the government is being urged to link job seekers' benefit rates to previous pay levels. That's the call from the Irish Congress of Trade Unions, as the weekly pandemic unemployment payment is to be further reduced from €250 to €203 from next week. The proposal would mean offering those who'd lost their jobs between half and 90% of their previous salary for a limited period of time. ICTU spokesperson Michael Taft says putting a ceiling of 3 to 6 months on it would press people to find a job quickly.
So it allows me time to actually find a job that's suitable to my needs, because one of the problems with a very low unemployment payment is that, I can't afford to be unemployed for too long, for 3 months or 6 months. So I'd better go out and grab the first job I can get, which may not be suitable to my needs. There may be a misallocation of skills in the labour market.
Any lingering mist and fog will clear, leaving a generally dry and bright day with spells of sunshine. Highest temperatures this afternoon, 9 or 10 degrees Celsius in a light west to northwest breeze. That'll back southwesterly by this evening. Tonight we'll see a little bit of mist and drizzle developing, and we'll see temperatures overnight of 2 to 7 degrees Celsius. That's Highland Radio News. We're back with news headlines again at 11 o'clock. Good morning. The obituary notices for this Monday morning, the 15th of November. The death has occurred of Donald Boyle, Upper Belcritch. His remains will repose at Midlands Funeral Home from 4 o'clock this afternoon, with rosary at 9 o'clock tonight. Viewing tomorrow from 3, with removal at 5:30 to St Mary's Church, Kincashla, arriving at 6 to repose overnight. Wake limited to family, close friends and neighbours only, please. Funeral Mass at 11 o'clock on Wednesday with interment afterwards in Belcrich Cemetery. No flowers or mass cards, please. The death has occurred of Patsy Breslin, Aya Ardra. His remains are reposing at his late residence. Funeral from there tomorrow morning at 11:30 to the Church of the Holy Family, Ardra, for funeral mass at 12 noon. Interment afterwards in the adjoining cemetery. Donations in lieu if desired to coronary care, Letterkenny University Hospital, care of Derek McCabe, funeral director, or any family member. The death has occurred of Tommy Porter, Monargan, Ardra. His remains will repose at McCabe's funeral premises in Ardra from 5 o'clock to 8 o'clock this evening. Removal from there tomorrow afternoon at 2 o'clock, going to the Methodist Church, Ardra, for funeral service at 2:30. Interment afterwards in St Connell's Churchyard, Ardra. Removal private to family only, please. Donations, if desired, to the church funds, care of Derek McCabe, funeral director, or any family member. The death has taken place of Kathleen McLaughlin, née Rowan, Breda Glen, Moville. Funeral from her home tomorrow morning at 10:15 for 11 o'clock Requiem Mass in St Mary's Church, Ballybrack, followed by burial in the adjoining graveyard. The death has taken place of James Toner, Drumdeven, Termon. James's remains are reposing at his late residence, with funeral from there tomorrow for Mass at 12 noon in St Columba's Church, Termon, followed by interment in the adjoining cemetery. Funeral Mass can be viewed on the St Columba's Church, Termon Facebook page. Family flowers only, please. Donations, if desired, to the Donegal Hospice, care of any family member. The death has taken place of Tom Hodgson, 408 Victoria Road, Ballamagorry, formerly of Derry. Funeral service at his home tomorrow afternoon at 1 o'clock, with interment afterwards in Derry City Cemetery. The death has taken place of Phil Gallagher, Rocktown, Falcarra. His remains are reposing at his late residence. Funeral Mass this morning at 11 o'clock, with burial afterwards in the adjacent cemetery. The funeral mass can be viewed live on MCN Media, Falcarra Parish Church. The death has taken place of Hugh Burney, Faunanohan, Milford. Requiem Mass this morning at 11 o'clock in St Peter's Church, Milford, with burial afterwards in Milford Cemetery. Funeral Mass can be viewed on churchservices.tv. Family flowers only, please. Donations, if desired, to Odyssey Donal Nursing Home Patients Comfort Fund, care of any family member, or Patrick Sweeney, funeral director. The death has taken place of Bernadette McNamee, 3 Ashfield Court, Mulhuddart, Dublin, formerly of Kiltyfergal, Clohan. Funeral Mass this morning at 11 in the Church of Perpetual Succor, Glenfin, with burial afterwards in Kiltyvogue Cemetery. Family flowers only, please. Donations, if desired, to the Alzheimer's Society, care of any family member. Funeral Mass can be viewed on mcnmedia.tv. The death has taken place of Eddie McLaughlin, Cockhill Road, Buncrana. Funeral from his late residence this morning at 10:20 to St Mary's Church, Cockhill, for 11 o'clock Mass, with burial afterwards in the adjacent cemetery. Eddie's funeral Mass can be viewed online on churchservices.tv. And the death has taken place of Teresa Donnelly, née Flanagan, 53 Primrose Park, Sion Mills, formerly of Cortober, Carrick-on-Shannon. Funeral from her home this morning at 10:25 for Requiem Mass in St Teresa's Church, Sion Mills, at 11 o'clock. Interment afterwards in the adjoining cemetery. Donations in lieu of flowers, please, to Melmount Manor Residents Comfort Fund, care of Quigley Funeral Directors. Requiem Mass can be viewed live via the parish webcam on churchmedia.tv. For more details, including any family health guidelines for wakes and funerals, please go to highlandradio.com.
Safeguarding is about putting measures in place to uphold our rights and support our health and well-being.
Safeguarding involves us, our families, services and professionals all working together to prevent adult abuse, neglect or coercive control. It also means empowerment if we face challenges with our capacity, that our voice is respected.
Adult Safeguarding Day is Friday, November 19th. Safeguardingday.ie.
Supported by Safeguarding Ireland.
It's time for NCBI Bingo on Highland Radio.
It's Monday, the 15th of November. You're playing on the green sheet. The reference number is S6. It's game number 46. The numbers are 59, 88, 70, 66, 69, 22, 11, 33, 29, and finally 44. Phone your claim to 9104833 before 8 tonight, leaving your name, contact number and the name of the shop where you purchased your book, and we'll call you back the next working day. Get all your NCBI bingo information at highlandradio.com.
All right, those were your bingo numbers, and you can get them as well on our website. But why do we do the bingo, and who benefits? Obviously, lots of you played and lots of you benefit out there. We had a €20,600 winner last Christmas. That was one of our jackpots since then. We've had 3 further jackpot winners throughout 2020. Amounts include 6,600, 6,400, 9,400, plus a share in the daily prize money increases those winnings even further. Now, June Tinsley is Head of Advocacy and Communication with National Council for the Blind of Ireland. Good morning to you, June. Thank you for joining us.
Thanks for having us on.
Right, it's good to have you on. It's good to be working with you on this bingo promotion because, you know, presumably it's more difficult to raise funds now. Maybe it's somewhat easy now. I don't know how things may go. But anyway, it's been a turbulent couple of years, to say the very least.
Very much so, no, and the radio bingo has been just so successful in the Donegal area, and much appreciated to all the players, and I hope they get as much enjoyment out of it as anything else. But essentially the funds that are raised are a core lifeline to the provision of our services. There are about 2,000 individuals who are blind or vision impaired in the Donegal area, and we work with individuals young and old, offering a suite of services to them, all designed to make sure that that individual can kind of live independently and confidently and stay socially connected with all their peers and be a core part of the community just like anybody else.
Yeah, and that's right from, say, for instance, if someone were diagnosed with a condition where they may see their eyes deteriorate, or perhaps they're born with a visual impairment, you're there right from whatever stage someone wishes to engage with the service, aren't you?
That's correct, yes. I mean, I suppose if a baby is born with a sight loss condition, NCBI is there to work with the parents to make sure that the infant can still meet their developmental milestones, all those kind of things. And as the child ages, we'll work with the individual to try and maximise any residual vision that they have so that the child can navigate their world independently and safely, can fully participate in school and all those kind of things, right up through to older adults who might post-retirement acquire a sight loss condition and suddenly find themselves in a situation where their world has been turned upside down and needs assistance, not only to work through that adjustment and the impact it has on themselves and their family, but also just in terms of any hobbies they might have or any outstanding work commitments that they might have, all those kind of things. NCBI is literally there through every stage.
Yeah, and if it weren't there, there would be huge gaps in a lot of what you've talked about there, you know, and that's why it's so important that people support the work of the NCBI as much as is possible. And one way you can do so is having a bit of fun with the bingo here in Highland Radio.
Yes, exactly. I mean, the radio bingo has, as I said, proven to be such a success, and it has ensured that we can continue providing these services. And I suppose if you can visualise, for someone who has acquired a sight loss condition, NCBI is literally there to ensure that they can navigate their own world safely through long cane training, for example, or to offer practical advice in the home, how to make their home more suitable to their needs, link in with their employer to ensure they can retain their employment, offer them advice around what statutory entitlements they have. I suppose every service that we have is there to match the needs of that individual.
Yeah, and again, I'm repeating myself to some extent, but this would be one of the core funding streams for the NCBI, and that's why it's so important.
Very much so, yes. I mean, we do have other funding streams, but as you rightly said at the beginning, many of our fundraising activities have had to be curtailed due to COVID. So without having this radio bingo on such a consistent station, it really wouldn't be able to deliver those services in that locality.
All right, listen, thanks for your time. We're going to speak to people who access your service, but for now, I want to thank you for joining us, June. We appreciate it greatly.
Thanks very much.
Okay, take care of yourself. That was June Tinsley, Head of Advocacy and Communications with the National Council for the Blind of Ireland. Delighted to welcome onto the programme now Mary Crossan, originally from Derry, but living in Donegal for over 20 years. You'll be soon classed as a local, maybe. Mary, another 20 or 30 years, perhaps.
Yeah, I'll give it another few years yet. I'm still blooming, but yeah, I'm here nearly half a lifetime. Right. But I've been welcomed with open arms. So,
yes, of course.
Yeah.
Now, tell us about your situation and your visual impairment. Is it something that came on in life, or something you were born with, Mary?
So my condition is with me since birth. It's called nystagmus. It's involuntary movement of my eyes where I find it hard to focus. So it makes me extremely short-sighted. And some of my siblings have this condition as well. So probably growing up, I found it difficult at school. Difficulty maybe seeing the board when the teacher was explaining things, and getting around and recognizing people. But I've just adapted, I suppose, because I've been used to it and have not known what good eyesight is. I've adapted, and
did you have to, Mary? I'm not sure what it's like now, or when you were in school, but did you feel that you and your family had to work around this? Was there much support in terms of saying, right, well, let's look at Mary's condition, let's see how we can make the situation as best as possible for her in that sort of learning environment?
There was some support, but this is over 20, 30 years ago. So I did get issued with magnifiers and stuff. But I suppose I found using them difficult in school because I didn't want to be classed as different. So I often didn't use them. But I know my nephews and nieces have went through school and they definitely had an assistant with them, whereas I didn't. So facilities now and assistant is much more prolific now in schools for children growing up. But I suppose when we went through school, you're talking 30 years ago, so there was those difficulties.
Right, okay.
But got through it.
Is it relatively recently that you began engaging with the NCBI, Mary?
Yes, so when I moved to Donegal 20 years ago, I moved here to do a music course, traditional music course, and I initially got in contact with them just to get registered with them. I knew in the north I had access to free travel, and living in a rural area here in Donegal, it was hard to get around. So I made that initial contact maybe about 20 years ago to get registered for a bus pass, free travel and things like that. And they were really good, giving me an in-depth assessment to see what my needs were here in Donegal. And they just provided me with extra magnifiers to help me with reading, and even TV glasses to help me watch TV and read subtitles and things like that. So that was my initial contact 20 years ago. And then recently I got in contact with them again. Life progressed and I had a few children. And but I just found over the last couple of years, my eyesight deteriorated again, and they have provided me again with extra better magnification, and helped out with technology, helped me get the hang of making technology more accessible, where I can see things on screen. With my harp tuition as well, I play the harp, so I found accessing tuition quite difficult because I can't drive. But everything's online now. It's amazing. I can contact my harp teacher over in England. So NCBI have helped me access or give me information about different stands I can have for my music, and doing online courses and touch typing, and just generally being supportive. And
that's what I was going to say, because a lot of it's signposting, and look, we know this could possibly work for you, but is that support element of it too, which I presume is really important. That understanding, that sort of maybe even being, solution focused with you. That kind of stuff.
Yeah, absolutely. Like the staff at NCBI has been really beneficial and fantastic there in Letterkenny and all over as well. Whoever's been in contact with me, they have been very supportive and understanding. It's a really vital service that they provide for the people, and I'm very thankful and grateful for them. So they go the extra mile. They think of solutions. I give them the problems that I have, and they come up with some solution or way around it. So they're definitely very, very helpful and beneficial to the
Brilliant
community.
Stuff. Your house is full of music by the sounds of things, Mary.
Yes, we have a musical house. I play the harp. My husband plays the pipes. He makes the pipes, and the children all play.
Do they work well together, the pipes and the harp?
You think they wouldn't, because the pipes are so loud and the harp's so quiet, but they actually...
You put him in the back room and you
I do. I can't hear myself play whenever he's playing, but they actually do blend quite well. And of course, they're the national instrument of Ireland. So, they actually go quite well together.
And invariably, your three children, twins, 11 and another who's 7, they're going to be have the musical bug, no doubt about it.
Yes. I continue to... I'm teaching my daughter the harp as well. So they'll carry on the tradition too. So.
Sounds wonderful. Maybe one day you might play something for us.
Maybe.
Listen, thank you for giving us an insight into the work of the NCBI and how in real terms it can help people. We really appreciate it. Thank you.
Yeah. Thanks for having me on.
Lovely having you on the show. Take care. The show. Mary Crossan there, originally from Derry, Donegal for 2 decades, uses the services of the National Council for the Blind of Ireland. So that is just to... as I say, it's not the bingo here. It's not a club, It's not like something. Oh well, sure, they're at it for ages. It's not like a bingo hall where you might be nervous walking in, which they're all very welcoming. I don't mean that as a slight. But my point being is that you can play bingo at any stage. If you go to your local shop around the northwest, you'll probably see the books close to the till. You can pick one up and play the bingo. It's €5 for the week, €1 for the day, and obviously only if it's for fun and you have the spare cash. But if you do so, you can win daily cash prizes in the hundreds, of course, and that jackpot's always up for grabs, growing all of the time. Now, even if you aren't successful, you can still perhaps have one last chance to win, because you can send in your books for weeks 47, 48 and 49, multiple books, break them off and send them in separately, I think that's how it works. Maybe people might get a card of them, but break them up and send them in separately, because the more books you put in, the greater your chance to win. So send them in to us here at Highland Radio, weeks 47, 48, 49, non-winning books, and then we'll do a draw on Friday the 17th of December on the 9 till noon show, nicely ahead of Christmas, to be in with a chance to win some great prizes. And we'll give you more details of those great prizes as we get closer to that time. So you're losing books, don't throw them away for weeks 47, 48, 49. Drop them into us here or get them into us. More books, more chances to win. We'll throw them all into a big box, and it is quite literally a big box. And the draw takes place on this programme on Friday the 17th of December. And for those of you who want to start playing bingo, well, there's a good reason for you to do so. But it's also to keep you guys updated. We presented a huge cheque last year, and we're going to be doing the same this year to support the National Council for the Blind of Ireland. As you heard from the head herself there, it's really, really important and valuable to them. And we just wanted to give you a bit of an insight into the good work that you're doing in having a bit of fun.
Today's 9 till noon show is brought to you in association with Ulster Tyres. Winter is coming. Get your tyres winter ready. Call in to Ulster Tyres in Letterkenny and Ballybuffet today.
Homeland Fuel offers, keeping you warm for less. 40 kg premium doubles or easy flame coal, $16.99. Buy 10, get 1 free. 1 kg fire logs, 4 for €5. 12-pack wood briquettes, buy 2 for €10. Shop in store or online at homeland.ie.
At ESB Networks, we're connecting Ireland to a clean electric future. And as part of the National Smart Metering Programme, we're now installing smart electricity meters in your area. Your new smart meter will reduce the need for estimated bills, help you to manage your electricity usage more efficiently, and enable you to access smart electricity products and services. We'll contact you before your meter is installed. Find out more at esbnetworks.ie/smartmeter.
Shop LK at Brian McCormick Sports and Leisure, Main Street, Letterkenny. Christmas Club now open. New ranges of clothing for boys and girls from Nike, Adidas and Under Armour. Adidas tracksuits from only €45. Nike quarter zips with matching bottoms from only €25. Join our Christmas Club today. Check in store for details. Look the part, play the part. In store or online. Click and collect on bmcsports.ie.
Candles, lanterns, Christmas trees, decorations and all types of lights. Everything you need for Christmas. Experience the magic of Christmas at Cooney's. Our biggest and best Christmas shop has outstanding value on lights and trees. There really is something for everyone at Cooney's Letterkenny Retail Park.
Christmas has come early, exclusively here at iMotors Drumkeen and Malin. Why not treat yourself to a new Kia or Nissan and avail of the fantastic finance offers available on all 221 vehicles. Order today and drive away in style in the new year. All new orders will be entered into a draw where one lucky winner will win €2,000 in cash. Call in today to iMotors Drumkeen or Malin or call 07491345567. T's and C's apply.
November 19th is UN World Toilet Day, a day to raise awareness of the 3.6 billion people worldwide living without access to toilets. The Think Before You Flush campaign are asking you to value your toilet. Let's look after our toilets and environment by only flushing the 3 Ps: poo, pee and paper. Put everything else in the bin. For more information, visit thinkbeforeyouflush.org. Think Before You Flush is run by Clean Coast in partnership with Irish Water.
Christmas is well underway at Letterkenny Shopping Centre. Park for free and get everything you need. Thank you for shopping with us this Christmas. Letterkenny Shopping Centre, bringing you the time at...
The time's 27 minutes past 10 o'clock on this Monday, the 15th of November. Right, okay, let's get to some of your comments. Thanks so much for them coming in. We really appreciate it. Wondering if you could highlight that the school buses are moving to 100% capacity between this week and next. Extra buses have been on to accommodate 50% capacity. How could they be moving to 100% capacity with cases the way they are at present? We're being asked to work from home, limit our contacts, and yet they're piling all our children onto the buses now at 100% capacity. I don't know the answer to that question. If I knew, I would tell you. But it's not spreading in schools, is it? So maybe it's not going to spread on buses. I don't know. I've stopped trying to work it all out to some extent. It's too hard. Right, now, you're good with the statistics. Is there any figures for those who are vaccinated and got COVID and those who are not vaccinated and got COVID? No, there's no statistics there. You are slightly less likely to get COVID if you are vaccinated. You're slightly less likely to pass it on. You're much less likely, which is you're much less likely to end up in hospital or with being assisted to breathe with a ventilator if you're vaccinated. According to the statistics, 65% of people in ICU and receiving extra care are not vaccinated out of the 8% of the population that chose not to. But still people, I suppose, are trying to counter-argue it one way or other, and that's perfectly fine. Hi, Greg, can you clarify this or explain it to me? As I understand it's legal, but I think it's very silly. There's a family in my local area with 2 sisters who are nurses. They live in 2 separate houses. Their daughters and one son has tested positive for COVID, but because the nurses are not showing symptoms, they're cleared to go to work in hospitals. What sense does this make? Long-time listener. Well, there is a testing regime in hospitals. I would imagine those nurses have triple vaccinated and they're not walking around, without PPE on as well. So I don't know the ins and outs of it, but I'd imagine that is the reason. But who's to say? It's no wonder the emergency department are flat out and struggling. Ran Now Doc yesterday at 4 p.m. The nurse called back after 9, advising the doctor would ring shortly after 1:30 a.m. The doctor rang 9.5 hours after we made initial contact. Inishowen needs more than one Now Doc, a big area for one doctor to cover. Now Doc and the GPs are overrun at the moment, according to reports we're getting in from them at the moment. Hi, Greg. I'd be 100% with any venue, hospital and nursing home doing an antigen test on me before I would enter their premises. I'm just so afraid what effect the jab would have on your organs, is it? I don't know. It depends. You could have issues with COVID in your organs as well. I don't know. I think I can understand why, people are very cautious. Some people are. But I suppose, we tend to trust the doctors with everything else, and then people get more inclined to trust someone on Facebook on this matter. I do struggle sometimes to get my head around it, but everyone is entitled to believe what they believe. So they ask everyone, are they vaccinated? So the COVID was brought into the nursing home unit by a vaccinated person, says that caller. Greg, just wondering, all I know is I don't know if that person has a loved one in a nursing home. Personally, for me, if I don't have someone in a nursing home or I'm not trying to access a nursing home, I don't really feel it's my position to comment on whether it's right or wrong. I think it's up to them to decide whether or not they believe that to be acceptable or not. I don't think it should just be chucked into the general narrative. I mean, these are people, many of them are vulnerable with their health. And as I say, the nursing homes, the people in them, and those who visit those people, I'll leave their opinions up to them because they're the ones directly affected by it and know what's best, I'd imagine. Greg, just wondering, will you highlight the issue of the 3 top organisations? I'll come back to that one because I want to do a bit of research and just check that one claim you made in that text just to make sure it's 100% accurate. And I'm not saying that you'd be misleading me. I just want to be sure because it could have consequences otherwise. Climate change evidence was physically to be seen in Donegal 30 years ago. The developed world lost this vital period to address the issues all over the world, says a texter there. Good morning, Greg. I fully agree with the comments made by Eileen about the response from the government officials to the Mica Group's demands. These mandarins are a law unto themselves, often misleading ministers and the general public. I've been representing a civil servant in a work-related dispute for over 4 years now. The mandarins concerned have repeatedly delayed the process and have misled the relevant minister related to a protected disclosure in the case. So fair play to Eileen and the Mica Groups for sticking it out and showing these unaccountable people for what they really are. Good morning, Greg. I don't think you would be shocked to hear the level of invasive species that have been and probably will continue to be imported into our environment and foreign soil. These species have been destroying our essential indigenous species, such as the humble earthworm, now in decline. We need a much more conservative approach to imports, similar to Australia and policy in this matter. Well done, Mexico, in returning to homegrown seed and showing Monsanto the door, they say. Right, OK. Keep them coming into us. 086 60 25,000. Give us a call, 07491 25,000. It's time for a little bit of music, and who better to provide that than Bruce?
Noon Show is brought to you in association with Ulster Tyres. Get your tyres winter ready. Drop in to Ulster Tyres in Letterkenny and Ballybuffet today.
At Life Pharmacy, we're focused on your family's health, immunity and well-being. This winter, call into your local Life Pharmacy for expert advice on vitamins, supplements and everything you need to support your family's health. Plus, ask about our special 3-for-2 offer on selected vitamins and supplements. Visit Ward's Life Pharmacy in Johnstown Village and discover a team that's always there to help you. Life Pharmacy. Live better together.
Drop in to your local library. We're open again for books, computers, events, classes, study, or just a bit of space. One more thing, make sure you enter through the front door. A Healthy Ireland initiative supporting health and well-being from the Government of Ireland.
Pull into the forecourt at Kelly Central Letterkenny, and there's so much more than just top quality fuel. Try the Frank and Honest coffee to go, a chicken roll from the Hot Deli, or maybe stop off for a full Irish in the award-winning diner. Browse the weekly shopping offers, or the great Christmas deals in the off-licence. Pull into the award-winning Kelly's Diner, Centra Supermarket and Forecourt at Mountain Top Letterkenny for so much more.
Christmas has come early, exclusively here at iMotors Drumkeen and Malin. Why not treat yourself to a new Kia or Nissan and avail of the fantastic finance offers available on all 221 vehicles. Order today and drive away in style in the new year. All new orders will be entered into a draw where one lucky winner will win €2,000 in cash. Call in today to iMotors Drumkeen or Malin or call 07491345567. T's and C's apply.
Northern Ireland's premier Christmas event, the Enchanted Winter Garden, returns to the award-winning Antrim Castle Gardens from Saturday 27th of November until Tuesday the 21st of December. This outdoor Christmas extravaganza has a dazzling array of festive attractions to capture the magic of Christmas. Be enchanted by the stunning illuminations, the spectacular Wonderland Wood, live music, festive fare and the Big Wheel. Why not make your visit extra special with a staycation or dinner? Check out our special offers and book your tickets at enchantedwintergarden.com. Sponsored by Belfast International Airport.
With all the stories that matter across the Northwest, it's Greg Hughes on the 9 to Noon Show on Highland Radio.
Okay, you're welcome back to the programme now. The Donegal Garda Youth Awards 2021 presentation took place in August at Letterkenny Garda Station. There were 4 categories in which an overall award was presented, and the 4 winners then went on to represent Donegal Division at the national award stage. And 3 of our winners from the Donegal Division have also won at the national level. And they travelled up to Portlaoise on Saturday to be presented with their awards. Now, we are joined on the programme by a number of these people. Katie Ward and Mia, what is your surname? I beg your pardon, it's not written down here.
Becky.
Bakey, okay. Representing Gormskull McDermott from Ironmore Island. Both of you very welcome. Thanks for joining us. It's good to have you on. Right, tell us about your mini company, because this is the one that picked up this award. I'll start with you, Katie. Tell us a bit about it.
During TY, we did a mini company under the stewardship of Miss Brennan, and we came up with the idea of a road recovery safety sticker. This was essentially a 2-metre adhesive sticker with the word recovered printed on it in reflective writing. Mm-hmm. So that this would be used to perform a simple yet essential act in the happening of a car accident where a car has landed in an unsafe area like a ditch. The sticker would be stuck to the exterior of the car after the passengers or the driver of the car have vacated and got the assistance that they require depending on the accident. This would ensure the drivers passing by of the instant that everyone has safely exited the vehicle and not to approach, as they could get into trouble while trying to see if everyone is safe. And this is where we come up with our slogan, "Don't let one accident to another."
Well, what a brilliant idea, because I've seen this before, and I'll give the example in a moment. Katie, what made you come up with this one? Because as I say, it's a super idea. That's not Katie, sorry, Mia. I'll ask you that, Mia, sorry.
It was part of the mini company idea, and Katie's dad and Katie were out one day driving, and they came across a car that was in the ditch, and they didn't know whether they should go over and check or not, because they didn't know if the people were selling it, but they realised that if they went in, they would cause damage to themselves or they would get hurt, so they came up with that idea then.
Yeah, because as I say, on my commute to and from work, it's going back a bit now. There was a car in a ditch in a very dangerous area, but people going past kept slowing down in this area to see if everything was okay. Right, so it's a simple solution to a problem. Katie, have these been produced, or did you actually get any of these printed out, or what's the story, or what happens next?
We actually got 30 of them produced by a company in Ranafast, Better Letter Signs, but because of COVID, we had to stop the production.
Well, stay there. Listen, I'll wait till that announcement's concluded, because you're being very brave there talking through it. Stay where you are. I'll come back to you, and then we can talk a little bit more. Neil Gallagher's there as well, representing Rossley's Community School, Dunloe. Good morning to you, Neil.
Good morning. Thanks for having me.
It's great to have you on the programme. Right, now, tell us about your award. What did you get it for, Neil?
We got our award. It was the group award for making a difference in the community.
And how did you want to make that difference?
We wanted to make that difference by breaking the stigma around periods and period poverty, given that many people can't access these products in very easily, and it should be an essential service to be giving these out. And we basically wanted to move forward in that direction. So we set up dispensers. We got in touch with the woodwork department in the school, and we had a few of our other male students design dispensers that would dispense certain sanitary products such as tampons, pads. And we also sent out surveys of what students wanted, and we took that on board, and we were able to adapt that to the product itself. And we actually have a working dispenser set up in our school in the girls' bathroom.
So the access is there, and we've talked about this both at this level and to senators and others in the past. You know, it's in your school, it's in the toilets there. It could be a pub, it could be a nightclub, it's breaking this stigma, isn't it? And this difficulty with access, but also, as you've been mentioned, the fact that how much money they have could be a barrier to access, and that just is not acceptable at any stage, but certainly not in 2021.
No, it is not. We also have had, in our Donegal County Council, we've had a motion passed which basically entails that all Donegal County Council buildings were to have either a dispenser or free access to sanitary products for free in every building.
And what has been the reaction in school? You know, are people more comfortable talking about it now? You know, that it's not seen as an issue. Maybe it never was. I think it might be a generational thing, Neil. But has it helped in sort of people having a conversation, feeling less stigmatised or whatever it might be? What has been sort of some other positive elements of this project?
Well, it's been a positively staggering response. A lot of the students do now feel more comfortable to take that conversation into hand, because beforehand you wouldn't have heard it from, say, like a lot of the male students wouldn't have known anything about it. It wouldn't have been mentioned by any of the female students. It wouldn't have been brought up in conversation, even between teachers, staff, etc. Students were very, very uncomfortable when it came to asking for these products. Many students that would have access to them would have brought them with them to school. Even though there are products in the school, the students just felt completely uncomfortable in asking and requesting these products. But now students have been coming back, using the dispensers, even giving us feedback, what they needed, what they didn't need, what they find suited them best, and any other tips to take on board. We've been taking them on, and it's been a very good response. And even the male students are able to converse about it without feeling any awkwardness or any stigma around it.
Yeah, and once something's out there, it's out there. You know, once people feel they can speak freely and can be open, that's going to be the way it's going to be. Are other schools looking on, Neil, to what you guys have been doing? And maybe they probably already have their own initiatives, perhaps in some schools. But is this something you'd like to see rolled out across the county and beyond?
Oh yes, definitely. A couple of schools have taken these, I suppose, steps in motion, and they've taken them on board to take into account into their own school, and maybe that there's a stigma there in their own school, or there's not any product availability. And there's also been working groups set up to make these plans a reality.
No, excellent, because what you're doing is feeding into the school community. It's good that it's feeding into the decisions that are being made at county council level, and it's also good that this conversation is now happening in the Shannon level and the Dáil level. We're a little bit behind the curve compared to other countries, but hopefully this is the type of a conversation won't have to happen for the next generation, Neil.
Definitely.
The problems will be fixed. Good man, well done to you. I appreciate you coming on the programme. Right, so that was Neil Gallagher. Katie and Mia still with us. The announcements have concluded. So I think, was it you, Katie, was telling us that you've already printed up 30 of these, or what happens next with this idea?
Well, we're in sixth year now, so we can't actually carry on with it now. So after the Leaving Cert, we're hoping to carry on with it and produce more and sell them on to the... We're hoping to put them into the new cars developed on the market, but that'll be a step away in the future, hopefully, if it carries on what we wanted to.
Mia, any other ideas? I mean, your time, I suppose, is short now in your school. You used to be going on to other things, but I mean, did you have any other ideas or any other areas you think we should be looking at in this area of road safety?
Well, whenever we finish school, maybe next year, we'll be able to look into it more and come up with more ideas for it. But for the meantime, we have a few people still want to buy them off us that are made, but we'll promote it more next year, maybe.
Brilliant stuff. Well, let us know and we can help with that. It's a great idea. It's so simple, and but some of the best ideas are the simplest. Why wasn't it done before? And what did you say the slogan was again? Don't let one act. What was that?
Don't let one accident occur from another.
Yeah, excellent stuff. Brilliant. Okay, thank you so much. Well done to the pair of you. That was Katie and Mia there representing Gomskull McDermott on Ironmore Island, a beautiful part of the world, of course. And Neil Gallagher, very well, doing very well, all three of them. But Neil in representing Ross's Community School in Dunloe. And also, I want to mention Ben King from Creasler. We have mentioned him before, but he won the National Award in the Individual Award category. He was nominated by Pro Social Ireland, the Pro Social Ireland Drivers Programme. It's a safety initiative that was set up in 2012. Pro Social Ireland seeks to improve the driver behaviour of some of the higher risk groups. Now, the Pro Social Ireland Peace 4 funded garage project focused on engaging with young people who were engaging in or who were identified as being at risk of engaging in antisocial driving behaviour. The target age group was for the project was 17 to 25 years of age and comprised of both males and females. And Ben had his role in getting that going and making it a success. And congratulations to him. He was a mentor and encouraged the students alongside the tutors to use their energy and creativity in a positive way. And I'm told Ben showed leadership throughout the programme and he excelled in his ability to mentor the other participants. Just 4 of our amazing young people we have in this county. Neil Gallagher, Katie and Mia Backey, I think it was, and Bakey and Katie Ward, and also, as I mentioned there, Ben King. Brilliant young people. Okay, back with more on the 9 till noon show shortly.
Today's 9 till noon show is brought to you in association with Ulster Tyres. Are your tyres ready for winter? Call into Ulster Tyres in Letterkenny and Ballybuffet today.
Dear Grandma and Grandad, thank you so much for my lovely present.
Dear Uncle Liam, a big thank you for my present.
Dear Auntie Sarah, thanks so much for my present. Unfortunately, it cut my finger.
And I got electric shocks off it.
There was smoke everywhere.
When buying toys, make sure they're safe and carry the CE safety mark, which means they conform to European safety standards. So if you don't see it, don't buy it. Learn more at ccpc.ie/toys for a safe Christmas. From the Competition and Consumer Protection Commission.
At Smith Steelside, we have been milling since 1865, covering the northwest and west of Ireland. For all your animal feed and nutritional needs, call Smith Steelside on 074 91 71 300.
Buncrana Hearts Football Club Development draw €75,000 in prizes. First prize €50,000. Second prize a Dacia Sandero plus 8 other cash prizes. Tickets available from any committee member or online at Club Funder. The Club Funder link can be got at Buncrana Hearts Facebook page. This ad is kindly sponsored by Inishgrass Buncrana.
At Liquid Therapy here in Donegal, we enable young people who need that little bit of extra time and support to experience the benefits of surfing and being in the ocean. Thanks to the Begin Together Fund, Liquid Therapy can be here for the families who need us.
Bank of Ireland's Begin Together programme supports people and community groups across the country with a vision, passion and drive to make things better. Because we believe tomorrow will be better if we begin together.
At Boots, our biggest ever Black Friday event is now on with a whole month of amazing deals. This week, incredible better than half price savings on some of your favourite brands, including Number 7, Soap and Glory and Marc Jacobs, now available with many more deals in-store and online. Boots, bags of joy. Selected stores offer in 16th November. See boots.ie for details.
Fabulous fabrics in stock for Christmas at Fabric World Maydown. Thousands of ready-made and made-to-measure curtains available at amazing prices, on trend and in stock. Now official stockist for Laura Ashley. Call in for a quotation to Fabric World Dairy. Great Euro rates.
Highland Radio weather updates with National Fuels, delivering home heating oil to Letterkenny and the surrounding areas at competitive prices. National Fuels, 9137 400.
Okay, now generally dry today with sunny spells developing after a rather cloudy start. Highest temperatures of 9 to 12 degrees and a light west to northwest breeze, backing southwesterly later. A caller says, I took my car for an NCT on Friday. I was asked for my driving licence. At first I could only find my passport card and presented it. He said he needed a document with my PPS number on it. I thought only government services could demand your PPS number. What would the case be if I sent another person to have my car tested whose PPS would be recorded in that case? Previous to Friday, I always used my passport card as identity. Thank you. I don't know if that's a once off or not, but let us know what you think. 08660 25,000. 08660 25,000. Right. Anne joins us on the programme now. Hi, Anne.
Good morning.
We're talking about services and services that aren't running. Yeah, Cashel na Cór in Buncrana. Tell us what this service is and how long it's been closed.
Well, it's day services for people with disabilities. My grandson, who's 26, goes there, and it's closed now, going on to the 4th week, because the staff from Cashel na Cór, they are hired by the HSE or whatever, and then they're redeployed onto residential settings where there was an outbreak. So Cashel na Cór was closed, and we've had no word about when it's going to open, if it's going to open, or what's happening.
What has the impact been on your grandson?
It's disgusting. I could sit and cry about it. He's going back to do things now that... Do you know what he does, Greg, in the morning? Now he gets up and he says to me, Granny, the bus, McGonagall's bus, because that was the first bus he used to go out to in Buncrana.
Yep.
He now has the changed buses, like he has the Muff bus, but it's the McGonagall's bus that he keeps going on about. And he takes me to the front window of my living room every morning and stands there at the time that the bus should be coming up. And when he knows that it's not coming up, then he gets all upset.
And every day it's the same every day.
Yeah, and he's going back and back and back and doing things that he had forgotten about.
Yeah, he's regressing. He's going back.
Regressing big time.
And you're seeing that, and you love him to death.
Absolutely, it's breaking my heart. It's breaking our heart. Yeah. Sitting here and watching him, because he's such a great guy. He's such a great guy.
Yeah.
And I absolutely do not. I've always said it, and I will say it. I never, ever, ever want to see Stephen's personality changed. But unfortunately, it's happening before my eyes right now, and it's just terrible.
Right.
It's just terrible.
We're going to make a few calls and find out what the story is.
Yes, I would like if you could find out.
Of course, that's what we're here for, and I'm going to follow it up. I'm going to chase it up and stay at it as well.
Please do.
You have my word on that.
Yeah, it's discrimination. It's total discrimination against the people in Cashel na Cór, in my opinion.
Yeah.
And it's my opinion that I'm going on. I know it's terrible.
Yeah, you feel discriminated against, and also that's on that emotional level. But there's sadness. The seeing progress, that story you tell of the daily heartbreak, it's new every day for him, waiting on
When
the
he goes
bus.
to bed at night. Yeah. I can't share him at the same time on a Monday, Tuesday and Friday morning, because he used to get 5 days, and then they cut it back to 3. I cannot share him on a Monday, Tuesday or Friday morning at the same time as he normally is, because he thinks he's going on the bus.
Triggers a routine.
Yeah.
Yeah, okay.
So, nobody understands unless you're in the situation, and it's just not a nice situation to be in.
Right.
Not for us, and certainly not for Stephen.
No, will you leave it with me, and as much as we can do,
That's great.
We'll chase it up and see if, at least, I think explanation at the very least is required.
Yeah.
At the very least.
Absolutely.
So there's
Thank
something
you.
to process.
Yeah.
And listen, love to you and the family, and
Yeah.
Stephen, your grandson, did you say?
Yeah.
I think he's
He's
very
26,
lucky.
yeah.
He's very lucky to have you
Well.
there. There's no doubt about that. Listen, thanks, Sam.
Thank you very much.
All right,
Greg.
take care.
Thank
Bye-bye.
you.
Okay, we're going to make inquiries on that. Back with the news, after the break.
Today's 9 till noon show is brought to you in association with Ulster Tyres. Get your tyres ready for winter. Call in to Ulster Tyres in Letterkenny and Ballybuffet today.
Buy a ticket. Buy a ticket in Highland Radio's mega draw to win a car. Get your ticket by November 30th and automatically enter an extra draw before the big draw. Big draw. One lucky winner will walk away with €2,000. Imagine, that's Christmas all wrapped up. Christmas sorted. The draw will take place on Wednesday, December 1st on the 9 till noon show. 9 till noon. And you're still in with a chance to win the Kia Exceed worth over €28,000. 28 grand.
It's that simple to win that car.
To get your ticket, log on to highlandradio.com. Highland Radio, exceeding your expectations.
Ooh. Incredible value and our widest ever range are top of our list this Christmas at Lidl. Like our melt-in-your-mouth deluxe infused salmon side for just $8.99. Or our selection of Cadbury Freddo and Dairy Milk packs from only $3.99. And a 20-pack of Heineken bottles was $24.50, now an incredible €15. The Christmas shopping list is getting shorter already. Lidl, more for everyone this Christmas. Enjoy alcohol responsibly.
Beat the cost of Brexit and no customs charges. Do you need a UK address? For your limited company or personal use, Space Hub in Derry can provide you with your own virtual office or mailbox. Have your post and parcels delivered to Space Hub and collect at your convenience. Also brand new 20-foot shipping containers now in stock. Ideal for all your storage needs at our Springtown and Coolmore depots. Find us on Facebook or spacehubderry.com or call 04871 878077 for details.
The day is almost here. Some say the most important one of the year. November 19th is the date when Tesco's Christmas home delivery and click and collect slots are open to book. This Christmas, nothing's stopping us, so give yourself a little help this year and book yours at tesco.ie. Be sure to book early. Slots will be going faster than, well, Santa's sleigh on Christmas Eve. Tesco. Every little helps.
Niall lives on a hill, a very steep hill, which is great for the calf muscles, but when it comes to squeezing in and out of that parking space between the neighbours' pride and joy, Niall begins to worry.
I wonder if they use recycled plastic to make all their recycling bins.
In the new Dacia Duster with automatic gearbox and hill start assist, at least hills are nothing to worry about. And from only €45 per week on the road, nor is the price. Visit the Dacia sales event from the 18th to the 20th of November. Don't worry. Be Duster. Offer made under a hire purchase agreement. Terms and conditions apply. See dacia.ie.
You're tuned to your number one local radio station. It's Highland Radio. This is the 9 till noon show with me, Greg Hughes. Lots coming up in the next hour. We're going to be talking sport with Brendan, and our Monday focus is going to be on domestic violence. We have a number of guests joining us. We want you to stay with us for those important topics. But at 11 o'clock, it's time to break for the news. Good morning once again, Donald Kavanagh.
Thank you, Greg. Good morning. The CEO of the HSE, Paul Reid, says the situation in hospitals is stark and there's a high level of stress and duress across the health system because of COVID-19. As of this morning, there are 617 patients in hospital with the virus, 106 of them in ICU. Latest figures for Letterkenny University Hospital showed 19 COVID patients in the hospital last night, none of them in intensive care. The Cabinet Subcommittee on COVID-19 meets this evening to discuss what measures may be needed to cope with the escalating cases. The wider use of vaccine certs, antigen tests and working from home are all up for discussion at that meeting. Letterkenny University Hospital was the second most overcrowded in the country this morning, with 43 admitted patients awaiting beds. Of those, 8 were on emergency department trolleys. There were 19 people awaiting beds in Sligo, 12 in the ED. That gives a cumulative northwest total of 62. Latest INMO figures show 401 people waiting for beds at hospitals across the country this morning. A 30-year-old man has been detained on suspicion of arson following a fire in the Rathmore Road area of Derry in the early hours of this morning. There was no one in the building at the time. Police say the blaze, which was reported just after midnight, was tackled by the Northern Ireland Fire and Rescue Service. It's emerged the car park at Glenveigh National Park reached full capacity on 24 occasions this year, meaning cars were being turned away at the gates. After getting the statistics in answer to a Dáil question, Deputy Pierce Doherty says urgent action is needed to ensure that locals and those who wish to visit the park are accommodated. Minister Darragh O'Brien told him in a response that a draft visitor experience and development and management plan is being drawn up. Deputy Doherty says that's to be welcomed, but it must be progressed speedily. And the government has been told it must bring forward plans to link job seekers' benefits with previous pay levels. The call has come from the Irish Congress of Trade Unions, as the weekly pandemic unemployment payment is to be further reduced next week from €250 to €203. The ICTU proposal would mean offering those who lose their jobs between half and 90% of their previous salary for a limited period of time. They say it would give people time to find a suitable job. And there are the headlines. We're back with news headlines again at 12 noon.
OK, Donald, thank you very much indeed for that. Back after the short break.
Safeguarding is about putting measures in place to uphold our rights and support our health and well-being.
Safeguarding involves us, our families, services and professionals all working together to prevent adult abuse, neglect or coercive control. It also means empowerment if we face challenges with our capacity, that our voice is respected.
Adult Safeguarding Day is Friday, November 19th. Safeguardingday.ie.
Supported by Safeguarding Ireland.
OK, we're continuing our Dementia Understand Together, our involvement in this initiative. It's designed to inspire people from all sections of our society to stand together with the 500,000 people living in Ireland whose families have been affected by dementia. And we want to help create an Ireland that embraces and includes people who are living with dementia and which display solidarity with them and their loved ones. Social interactions, healthy like exercise for the brain, and can slow down symptoms, including deteriorating memory. Staying socially engaging with friends and family has been shown to boost self-esteem, and for people with dementia that means better eating habits, more exercise and better sleep, of course, and being with each other to talk and share experiences nurtures the soul and gives a sense of belonging. And Fionnuala has more.
We all understand the importance of social interaction, being with each other, connecting and sharing experiences, now more than ever. But did you know social interaction plays a key role in helping people who are living with dementia? It's healthy, like exercise for the brain, and it supports well-being, which has positive benefits for the person. Staying socially engaged with friends and family has also been shown to boost self-esteem. A dementia-inclusive community enables people who are living with dementia to do just that, to live. Whether that's staying connected to or joining a club, taking up a hobby or visiting their local shop. Being with each other to talk and share experiences nurtures the soul and gives a sense of belonging. You can be that connection. For more information and support, free phone 1800 341 341 or visit understandtogether.ie. From the HSE in partnership with the Alzheimer's Society of Ireland and Age Friendly Ireland.
All right, thanks for that. You're welcome back to the programme. Brendan Devaney is going to be in studio with us shortly. But some of your comments in the meantime. There was a neighbour of mine taken to Dublin Hospital for an operation to find out if his cancer has spread. He was fasting. Went through all procedures in hospital for the operation. Then an hour before the op, they cancelled it, saying some of their staff had COVID and send the man back home to Donegal. This is a God-damned shame, to quote them directly. I presume what they were saying is that they don't have the staff to conduct the operation, and that is, if people want to let the disease spread as it is at the moment, this is the consequence of it. It's not always about whether or not someone will catch COVID or get sick of it. It's the knock-on effect it has on on other areas of health, tragically. Read the caller wondering 100% on school buses. Never mind the crowding on school buses. The providing your child with additional vitamin C and D is a barrier to viruses like we got when we were going to school back in the 70s. No viruses were overcrowding in A&Es back then. I think you need to just open the history books there if you think there were no young people dying in the 70s, I'm afraid, from viruses. If the government are this worried about COVID, why don't they give the testing kit for free like Northern Ireland? Yeah, or subsidise it heavily. Maybe that's what they'll end up doing. Right, okay. Brendan Devaney is hot-footed it into studio. I think you could call it hot-footed. Hiya, Brendan, how are you?
You were hot-footing it on Friday night, not dance from Greg.
Foot loose, you know.
I'm telling you, I didn't realise you
One
didn't
second
put
there
those
now, before you, if you're going to give me a good touch, I want people to be able to hear it. You know, there's no point you wasting your energies and people not getting it. Right, we're good. Your mic's up there now. How are you keeping?
Good, Greg.
We'll have to have a quick word on your DV ball. You must be delighted with how it went.
Yeah,
a lot of organisation, a lot of effort went into that.
Aye. I was a bit crazy, Greg. Yeah, first time I've ever did anything like that in my life. So, you know, had so many people in behind me helping me. You know, here in town, Kieran Brogan and Kieran O'Donnell and Alan Foley and Aidan Cannon and all my family and that were digging in. But a lot of things did come back to you. You know, there's a lot of things happening there because people were texting, messaging, tickets and tables and sponsorship and different things. And Margaret went round town, my sister, and so many businesses donated to the raffle.
Yeah, you're going to end up with a dose or something now. That's what happens, you know, because there's
a dose going about.
Yeah, but there's so much adrenaline goes into something like this and so much time, and you build yourself up, and then it happens, and it's like, okay, but anyway.
Yeah, you're not too sure how to feel in the days after.
That's it.
It was just non-stop, Greg, right
Brilliant.
up into the night, but everything went well in the night. Everybody had a great night.
And fundamentally, a lot of money was raised for very worthy causes, and I'm sure down the line you'll shout that out.
All up. The GoFundMe page is still getting money in.
How do people go onto that if they want to?
Yeah, just the V's charity ball. If you just search that GoFundMe, it just pops straight up and you click in. It's very simple. Just go straight through your phone. Couldn't be easy.
All right, good stuff. Right, okay. You barely had a half an hour in bed, I would say, and you were back out at the sport then on Saturday. I was listening to the commentary, the both of you. It was excellent at the weekend. So I presume that's the action. The games of the weekend is going to be the focus of the DL debate. Tell us what's going on.
Yeah, we're looking at obviously the intermediate final replay out at the park. Now, great. I was just thinking all the games are at the park. I live up the road.
It's handy for you, wasn't it?
It's a big difference. The intermediate final was yesterday. Of course, the fabulous news about Geraldine McLaughlin, you know, finally getting this. I joked with her last night. Now, Geraldine, you don't get this Ulster, there's going to be riots. Letterkenny, there's going to be trouble, and Termon, I'm telling you, there's going to be trouble everywhere. But I think finally the recognition was fantastic. It was Termon coming up to Division 1, so it was a good weekend for everybody in Termon as well. So fantastic weekend for Downings and Cloughaneely, and we're going to look across the various championships as well. Tyrone, Dromore won in Tyrone, and there's some people hadn't won titles in 67, 58 years.
Yeah, there's history being rewritten, wasn't there? And there have been for the last couple of weeks as well.
Seems to be a lot of underdogs. Yeah, underdogs, and a lot of places seem to be coming through it.
Do you know what the problem there is? It's you pundits, because you are putting these boys down as underdogs and these girls down as underdogs, and they're just proving you wrong.
They step
so
up.
It's not that nothing's happening on the pitch. It's all you guys getting it wrong. Could that be it?
It could be. Yeah. The tipsters.
What was your surprise result of the weekend? Would you say?
I would say more surprise performance.
Right.
Greg, you know, last week 2 weeks ago Dunloe played phenomenal. Came into this game, Cloughaneely, everybody said played none, but the difference then, it completely flipped. I mean, it was so strange. Last week, the first game was 7-2 at half-time, New Dunloe in complete control. This week it was Cloughaneely were 7-2, exact same opposite scoreline. Difference was there was a kick then in Cloughaneely with goals, and they came back. But they were absolutely phenomenal.
That's where coaching and tactics comes into it, does it? The Cloughaneely made the changes and made Dunloe says, right, we did well with how we played last week. We'll just keep more of the same.
Yeah, I've seen that myself involved in replays. If you played fairly well in that first game and it's a draw, and you think the other team, they have so much to come up. But listen, they were absolutely brilliant. And then yesterday, a lot of people found the Letterkenny Gales Downings game hard to call, and Gales just didn't turn up at all. You know.
Yeah, I think there was a few people. You know, Gale supporters were a wee bit nervous about that one going in themselves. I don't know.
It looked like, again, listen, I haven't seen enough of them to really comment on it, but they had their defensive shape right, but going forward then, there didn't seem to be, You know, Downlands had quite a bit of ingenuity. Players would pick the pass, maybe take a man on and take a score. And it seemed like Gales had got their defensive part of their pitch okay, but going forward in, they didn't seem to have much an attempt at all. It really petered out, you know, and there was so much, I suppose, atmosphere. Donald Park's great for that type of crowd because everybody's in the one stand. You know, they're not here, they're not everywhere. They're just in that stand, and it creates a great atmosphere. But it was lacking yesterday.
But I think a game requires it to be somewhat in the balance. Or either that or amazing football, but it requires a game to be in the balance. And that game was never. It seemed from early on it wasn't in the balance, Brendan.
Yeah, Downlands were in complete control. And at a time when Letterkenny Gales desperately needed, and the game needed a goal, Downlands got the goal, and it was just a see out the time. Then, you know, it was getting so dark there yesterday as well. But listen, Downlands after losing last year's final. No, after losing last year's final, I suppose. It's massive then to come back. And I was just thinking about Cloughaneely as well, all the hurt that they went through, and I was just thinking their journey maybe meant them a wee bit tough that they were able to come back last week. Whereas Dunlow, young team down, maybe they have to have a few experiences before they can jump back.
Get a few knocks. Yeah,
seems to be the way of it.
Bounce back ability, isn't that what it's all about? Right, okay, so it's going to be a packed show. Run it through us again. What's on the show this evening,
yeah,
Brendan?
Just like I say, the intermediate and junior recaps. We're going to obviously talk about Geraldine. We have a fella on, Michael from Gaelic Life. He's going to talk to us about the Ulster Championships. Of course, looking ahead to St Eunan's game next week with Glen Maharab. Big game again in the park. So of course,
I don't know who's involved in scheduling, but you must be slipping them a few quid.
Because that intermediate game, of course.
And what time does that one start at?
It's 1:30 next Sunday.
You sure?
Cloughaneely are playing on the Saturday in the park against Steelstown as well. So yeah, it's just great to see. Makes life a wee bit easier.
Excellent, good stuff. All right, listen, the DL debate's on after the 7 o'clock news this evening, and then lots of people choose to podcast it as well. It's going to be a cracker. What are you going to do with all your spare time now? Sure, you've nothing else to be up to you.
Take a big sigh. The couch is going to be my best friend, I think, the rest of the week. So, all right, well, sure. Kieran O'Donnell's even coming on for a yarn in the show as well, so he's popping in here later, I think. So
happy days. All right, listen, well done. On Friday again, you did really well. You pulled out a big show, and it was really well supported. And also, good luck with the show this evening.
Yeah, I'm looking forward to seeing Plan International, Cancer Care West, and Focus Ireland, Greg, because everything we raised on the night went to them. Because my buddy in New York, the only two expenses in it was the sound system and the band, and my Kieran Keaveney, a Roscommon man, he paid for them. So every penny came in.
And it was good to see them platform to get an opportunity to explain the difference it would make too, because often that gap isn't bridged, so people got to see that. All right, good stuff, Brent. Thanks very much.
Thanks,
all right, we'll be back with more after the break.
Today's 9 till noon show is brought to you in association with Ulster Tyres. Are your tyres ready for winter? Call into Ulster Tyres in Letterkenny and Ballybuffet today.
Ho ho, festive folk. It's fair to say we deserve to go big this Christmas. And at TK Maxx, we've got every fabulous gift you need to Christmas to the max. There's designer steals for everyone, from your mum to your secret Santa. Big love at small prices this Christmas at TK Maxx.
No matter how busy we are, how can we make the most of our lives each day? By spending quality time together, or spending time giving back? However you spend each day with Debit MasterCard, spend it doing what matters most to you. Because a life well spent is truly priceless. Learn more at mastercard.ie.
Have you got a one-for-all gift card that you've yet to spend? Now is the perfect time. Go and treat yourself in any of the 11,000 one-for-all retail partners before December 31st, and you could win €10,000 in cash. Pennies, Argos, B&Q, Curry's PC World, TK Maxx and many more. Simply spend your gift card and visit oneforall.ie/win for your chance to win. Terms and conditions apply. The One for All gift card is issued by GVS Prepaid Europe Limited. GVS Prepaid Europe Limited is regulated by the Central Bank of Ireland.
My name is Adrian Corcoran. I'm a guard attached to the Roads Policing Unit. Last year saw an increase in fatalities on our roads. These are needless and preventable deaths. We all share the road. However you use it, please be careful and keep each other safe.
Together, let's save lives on our roads. A message from the Road Safety Authority, the Dublin Fire Brigade, and An Garda Síochána.
At Cooney's, we have quality suites, chairs, tables, beds and mattresses all at fantastic value. If you see it, you can buy it and we'll deliver to your door in time for Christmas. Call into Cooney's at Letterkenny Retail Park.
Business owners, are you wondering what to do for your staff for Christmas? Well, at Kelly Centre in Letterkenny, there's great hampers to suit all budgets, with delivery available. Luxury hampers are a speciality. There's also vouchers for Kelly's award-winning diner or Circle K fuel at the forecourt. Get Christmas sorted for your staff now by calling Kelly Centre, Mountaintop Letterkenny on 91222026.
At Letterkenny Shopping Centre, we're already dreaming about the festive season, so why not make a start? Park for free and enjoy your Christmas shopping this year. Letterkenny Shopping Centre, bringing you the time at...
Now, you're very welcome back to the programme. The time is just approaching 17 minutes past 11, and it's time now for our Monday Focus. We're discussing domestic violence. Donegal recently launched a new resource pack called Donegal Domestic Abuse Resource Pack for professionals working with children and families. It was launched by the Domestic Abuse Working Group of the Safe and Secure Committee of Donegal Children and Young Persons Service Committee. We're joined in studio by three guests today. Firstly, we'll say a good morning to Superintendent Gretty Sheridan. Thank you very much for joining us. It's good to have you with us. Also a regular guest on the programme, Dr. Marie Hainsworth, Manager of the Donegal Domestic Violence Services. Good morning to you.
Good morning, Greg.
And also we're joined by Inspector Siobhan Mullihan, if I have the pronunciation correct.
Yeah, you have it there.
Okay,
Good
listen,
morning.
thank you very much, all of you. Right, I suppose, shall we start with you, Goretti? I suppose the important thing, some of the important information to get out there is that the services are there, the help is there, and for people to engage with them.
That's correct. And I suppose just to start off to say what domestic abuse is, Greg, and for the listeners, that it's physical, sexual, financial, emotional or psychological abuse of one person by another within a family environment or by a current or previous intimate partner. And it occurs regardless of socio-economic group, race, religion, gender or sexuality. So like we see it, it's occurring across all walks of life, all ages, all status in society. So here, the Guardian Donegal and Ireland have attended domestic incidents on a daily basis. Overwhelmingly, the most common type of call we attend to is when a woman is being abused by their male partner, past or present. However, men can also be subject to domestic abuse, and they don't report as much, it appears. Children in homes where domestic abuse exists experience this domestic abuse also. It can be present in the shape of abuse of older or vulnerable persons by their carers, partners or relatives. There's diversity among victims. The abuse we see varies from low level and persistent abuse to short and extreme abuse. And we're mindful of escalating abuse within society, and I suppose we're called to incidents on a regular basis. Even the weekend past, again, a number of domestic incidents. So that's just to give a brief outline to domestic.
And is there sort of a typical example of those calls? Is it a dispute in a property or something, and someone will call in an emergency situation, or is there a?
It could be just a simple. Sometimes it may be a neighbour ringing in about hearing maybe a domestic next door, and it may have escalated to physical violence at that stage.
Yeah, and of course that is counted in statistics, but it's not going to be in newspapers or in the community guard or slot. But it doesn't mean it's not going on, and you've said quite clearly it happens very regularly.
It's worrying, how often it happens, and we don't hear about it all, but it's going on across all elements of society.
Because of course abuse can be ongoing. All the types of abuse you've mentioned there, that and it might be just in a one occasion that that phone call is made. That doesn't mean it only is happening on that one occasion.
Yeah, often when a victim actually makes the decision to contact the guards, things have come to to a point where they can't cope anymore, and up until that they've experienced, the research would indicate they may have experienced over 30 incidents of domestic violence at that stage before they actually have the courage then to ring and look for help.
This is a purposely leading question. How seriously do the Gardaí take domestic violence and these types of calls? If anyone's listening and going, sure, what's the point? It might take them hours to get out here and at that stage. And do you want to talk a little bit about the attitude towards it from An Garda Síochána and the resources and how they're deployed when needed?
Domestic violence at the minute is at the forefront of our policing needs. From the Commissioner down to ground level, there is a vested interest in investigating domestic violence incidents. All Garda staff, Garda members, from Commissioner level down to ground level, have undertaken online training in relation to domestic violence. We have our own protected services units being set up across the country, and one here in Donegal also, where we have staff trained in relation to domestic violence. And we have domestic violence champions across each of the districts also. So certainly there's many factors to domestic violence, and we would encourage anybody listening today who is a victim or who suspects that they know somebody that may be a victim to contact the guards, and at the very least even to get advice in relation to what's going on.
And we've talked about this on a number of occasions in this programme. There is procedures and ways of dealing with these issues as well once contact is made, isn't there? And is it around anonymity and things like that there, and Gardaí understanding that maybe someone has someone watching their movements very closely or whatever. I mean, that's all thought through and there's plans in place for that.
Yeah, absolutely. And at the end of the day, even if they contact the guards, it's not always that there has to be a prosecution. The thing is that they actually look for help, and then we can point them in the right direction to the likes of Marie and her team, or to other services that are out there. Like, we would never put anybody under pressure to make statements of complaint to us. That's the priority, is to get them to make sure that the victim, and if there's children or anybody else involved, that they can feel safe in their home.
So one call does not necessarily trigger a train of events. There's processes and procedures and options and all that type of
and there's
stuff.
loads of support.
And the only reason I'm emphasising that is because it could be a barrier to someone ringing up, but that doesn't not there. Sorry, what were you going to say?
I was just going to say, like, you don't have to leave to be supported. It doesn't mean you don't have to leave your family home to be supported. So there's
Siobhan, do you want to talk about this domestic abuse resource pack?
Yeah, so this was launched in October as part of Social Inclusion Week in Donegal. Myself and Marie are on the SIPSI, Safe and Secure subcommittee, and I suppose it was launched as a resource from our working group, which included the Donegal Domestic Violence Services, the Donegal Women's Centre, the MACE Project, the St Johnstone and Carrigan's Family Resource Centre, and TUSLA. And I suppose it's a roadmap really for professionals or people who may come across people who are experiencing domestic abuse. You can see yourself, it details all the services that are available, from the guards, TUSLA, the Sexual Assault Treatment Unit, Donegal Domestic Violence Services, and also importantly the signs and symptoms, I suppose, of domestic abuse and what to look out for, and coercive control.
And just in relation to that, it's really, really quite it's interesting because there might be people that pick this up and would read through the type of domestic abuse and not realise that they might actually be in an abusive relationship.
Yeah, very definitely. I mean, we see people who don't realise they're being abused themselves, and sometimes even though it can be visible to people outside, that person could be traumatised and they could be suffering from trauma and not realise that they actually are a victim.
They make that connection.
So maybe a friend or a family member, if they come across somebody like that, just to see what's available, see what the signs are, and talk to them, support their friend, and refer them to the services as necessary.
There's also interesting information as it relates to terms, domestic abuse terms and phrases, because lots of people may be hearing more coercive control lately over the last couple of years, but might not know precisely what that is, or what's if something's happening to them on a financial or social level. I mean, that's all laid out quite simply there in this documentation as well.
Yeah, and it's available online for anybody at www.cipsi.ie, and there's also hard copies available if you want to contact myself at Letterkenny Garda Station, or Marie or Anne Timony Meehan, the SIPSI coordinator as well.
Yeah, and as you were outlining too in this booklet as well, it's what happens when you make contact, what happens next too. That's all contained within it. Dr. Marie Hainsworth, you're manager of the Donegal Domestic Violence Services. I mean, we speak on a regular basis, don't we, about this, and also to maybe resource issues in you helping people. What is the situation now from your perspective in terms of, you know, the tools you have to hand to help people when they reach out or referred?
Yeah, I mean, obviously the last couple of years has been particularly difficult because of the COVID, you know, and access to resources has been a little bit more challenging. But the biggest challenge facing us at the moment is accommodation, because it is a national crisis in terms of housing, but particularly in Donegal, there is an extreme shortage of properties. And even though during COVID they announced the rent supplement, you probably saw that, where someone who is fleeing a domestic abuse relationship is no longer needs to be means tested in order to get the rent allowance. The problem is you still need a house to flee to, and that's our biggest hurdle at the moment. People often, you know, often the guards are called out to a situation. We want to make it as safe as possible for the people who are being abused, and often the only way to do that is to provide them with some additional accommodation, and that's where we're meeting difficulties.
What can be done about that? Because obviously there's a lot of people competing for properties and houses, aren't there? Not competing, but, you know, a lot of drain on limited resources.
And the bottom line is, I mean, the Department of Environment needs to be providing more social housing, because that's where we're relying too much, I think, on the private rental market, which was never designed, you know, to compete with social housing. And it's because of the lack of social housing, you've got a lot of people looking for rental properties, and the rental properties are going up. Like, they're now hitting over 1,000 a month, which, you know, that's almost like 100% increase in the last 3 or 4 years. So there's a lot of people who are accessing the HAP payment, rental allowance, or on social welfare. They just can't. They're being moved out of that rental market. So it's not even a stand-in for social housing anymore. And at the moment, like, luckily during COVID, TUSLA have upfronted some of the payments around emergency accommodation. We've had to use hotels, B&Bs, but that funding will all stop next year. Local authority isn't paying it because their department says that they're not responsible for domestic violence, homelessness, and TUSLA are only providing funding through refuges. They don't do informal. So we're going to be stuck shortly.
We need a short, medium and a long-term plan. This, you can't, with the difficult job that's already being done, we can't just keep firefighting every problem. We need a plan, don't we?
We do, and it's no good having guards going out to a situation and then looking to move people on, and then there's nowhere to move them on to. So, like, there's a huge dependency there that we can provide hotel accommodation to back up their work, and that's been fine over the last year, but it's next year that we're worried about. You know, what happens then?
Yeah. And is there anything we can do? Like, is there any, implore the public if they've got a property available to make it available? I don't know. Is that realistic? I mean, how do we...
We have had offers, and I know people are obviously out there, you know, they have to meet all the requirements and stuff, and people have offered properties. The problem is the cost of it. Who pays? Because at the end of the day, nobody's going to offer property for free. If we have got access to the property, that's great, but then we need the backup of state authorities to give us the funding to pay the landlords. And that's in the absence of no social housing. So that's really where we need the lobbying. We need it lobbying that HAP payments aren't enough. You know, they're not meeting that shortfall. And I know the homeless sector is involved in that, but we also need people to lobby that we need additional funding, you know, in terms of housing specifically.
Yeah, it needs specific focus. You know, I get you. Now, let's talk about the 16 Days campaign launch, which is taking place on the 23rd. I don't know which one of you want to speak to that. Is it Marie?
I think, yeah, we organise that. So it starts on the 25th, but we're actually, I suppose, hijacking the launch of the resource pack, which is also happening again. SIPSI have a launch on the 23rd. So we're actually, as part of our 16 Days, we work with young people. I think some of the youth reach services and some of the schools in Letterkenny have produced artwork on the back of the Healthy Relationships programme that we do. And we want to use, I suppose, this forum to publicly show it, because it's quite hard. With COVID, we couldn't do anything last year. It was all online. So this year we're looking to do it at the Angrenian Hotel up in Burt.
It's important there's a conversation, awareness and education of our young people, isn't there? So, you know, we try and stop the conveyor belt of people that believe it's okay to treat other people like this, that it's in some way acceptable, that it's positive or constructive.
Yeah, the conversation on, just respect within relationships and healthy relationships, which impacts on everything. It's not just domestic abuse, it's bullying, it's all the rest of it. But it is that notion that, how you treat other people is important, that we can challenge negative stereotypes or negative behaviours at an early stage. So I think the artwork has been a good way that people have kind of thought about the issue and put it across in a way that other people, sometimes visually it says a lot more than written statements or people talking about it all the time.
Yeah, because Goretti, obviously we've been talking about the Garda response. Ideally, we want to get to a space where we're stopping this sort of behaviour ever starting.
Yeah, and I suppose on that, and as I alluded to earlier, this abuse is taking place across all age groups. So there are teenage and young boys and girls who are currently victims of domestic violence, in their own relationships. And again, it's just creating that awareness and understanding that that type of behaviour is unacceptable. And again, it's between ourselves and Garda Síochána doing work with the schools and doing work with families and other, I suppose, let's say the likes of hairdressers or taxi drivers, people that are out and about that are going to be interacting with young and old people. If there's an opportunity to get information in relation to, or give information in relation to the services available to victims of domestic violence, that's that we can do that as well. But it's to start the conversation. The conversation has started, but I think it's to spread the conversation and it's not just happening behind closed doors. Sometimes it's happening blatantly in the public. More probably likely the financial control and the coercive control. But again, it's just that the young people and the old people across the board, that everybody is aware.
Because maybe quite naively, someone like myself might have hoped that, the conversation we were having, for instance, about, coercive control being a crime, we had one of the first convictions, we had the first convictions, I think, without a trial here in Donegal, and then there were subsequent convictions down the country. Has that led to more awareness, or is it more detections or more instances? Do you know what I mean? Because sometimes when we see an increase in figures, is it happening more often, or are people sort of saying, right, I can contact the Gardaí about this, what's happening to me is a crime? Not just in that area, but in domestic abuse generally, I wonder.
I do think certainly the legislation change and the media, awareness created around that certainly escalated. I suppose our protected services units have been established. There's more awareness across all agencies, and there's more interagency work going on. And I think people are maybe more aware. There's more information available online in relation to the matter, so they are coming forward. And we do have, families, work colleagues, neighbours, reporting in as well in relation to, concerns they have. So I think that there is more talk about it, but I'm worrying about the people that are not engaging, because
100%.
They are.
Well, can we talk about that? And I don't know which one of you might prefer to, but someone who's listening, who feels they are trapped in an abusive relationship, and they're fearing that it's only a matter of time before it escalates, who do they reach out to at this point? Is it the guards, Siobhan?
Certainly, yes. In an emergency situation, obviously you call 999 straight away if you really are in fear. But if you want just to make a phone call to your local station, all the district headquarters are 24 hours a day, just to see what your options are, or any of the support services like the Donegal Domestic Violence Services.
Can I just talk on that? And this is, I'm not trying to say anything negative about the Gardaí, but there might be a historic attitude that maybe this is seen as something that can be fixed in the house, or you know what I mean, or not taking it seriously or whatever. I mean, I have heard stories of that historically. Things have changed now in terms of how those calls are dealt with, what actions are triggered, people being trained to deal specifically with this type of incident. I just want to focus specifically on how that's, perhaps, if it were ever a problem, has changed now.
Yeah, well, domestic abuse, it's a top priority for all Gardaí across the country. And when we receive a report or we go to somebody's house and we deal with them, we do a call back with that victim within a week. So that call back can be in person or by a method chosen by the victim, for example, by email or by phone call, whatever suits them. But during that call back, we'll be asking them certain questions to risk assess their safety. We'll help them safety plan if they need to do that, maybe to escape a violent relationship. We'll give them information on the barring order, safety order, whatever option they want to take. And as Superintendent Sheridan said, it may be that they want to maintain the relationship, but just give them the support. Maybe they should get a safety order to ensure the protection there and then in the house, and they can call us then. And if we become aware of a breach of an order, we are duty bound to arrest that person and bring them before the court. So there is that, but just general information. But as I said, it's a top priority matter for us, and not only do we call back within a week, we also call back within a month and 3 months again. Okay, and during that time, all the time, we're hoping to build up a relationship, convey trust to the victim, that they'll be able to tell us, and if they want to get involved in the criminal justice process, that they'll feel confident to do that.
Yeah, and I suppose that superintendent, it's your role to make sure that's resourced and is actioned upon.
Yeah, well, I suppose there's 4 districts in Donegal, so you have Buncrana, Letterkenny, Milford and Ballyshannon. So I suppose really there's a vested interest, and from our Chief Superintendent Terry McGinn, there's a vested interest across the county to support victims of domestic violence, and the families and the children. We have to be conscious that the children that are experiencing it, they may be lying in their beds, but they're still they're still exposed to domestic violence. So there's definitely support across the whole organisation to police it. And
that's also addressed, Siobhan, isn't it, in the pack here, the impact it can have on children and signs and signals there. Yeah. And one thing also that's written across every page, it's been mentioned, in an emergency, it's you ring 112, isn't it, 999. What do we need to be doing more of? You talked about, I suppose, Marie, about when you are trying to help people, but to try and break the cycle or something, and it seems a repetitive conversation. How do we start making inroads? What do we do to actually say this is completely unacceptable behaviour, it has to stop? I know people probably texting in going, and it was already referenced early, men get abused too. That's been accepted, but not. How do we get past them and us, that we see it as a whole society problem, regardless of gender, and that we all play our role in it's so avoidable,
It is. I think one of the things about domestic abuse and why it does get so gendered is because it does play on the dynamics of gender, and it plays a lot on the traditional roles. So it becomes quite easy for one partner to suppress another just because of the society. And so they're the kind of things that we need to start challenging early enough, that there's no, the gender stereotyping of young children, that girls are expected to do this, boys are expected to do that. Until we have more general conversations around equality and acceptance, these attitudes will continue to prevail, and that's unfortunate. Even within the different agencies, domestic abuse is quite a complex crime, so there's a lot of work going on behind the scenes to raise awareness around what is high risk, what is low risk. When someone, often guards are called out to a situation that has perhaps de-escalated by the time they get there. So how do you review a crime scene? How do you review who says what? How do you take evidence from from victims? So all of that kind of education is also ongoing with agencies. And that was part of the thinking with the resource pack, that agencies need to be upskilled a bit in terms of dealing with domestic abuse, and then we can begin to filter that conversation down. And if in the meantime we're having more conversations around equality and just engaging with other people and healthy relationships, so it's kind of different pronged. You can't do it all at once. It's not a simple solution, but I think what's positive, and certainly ventures like this show that there is that communication, there is that willingness. The guards also have an interagency forum that we feed into, where they are now reviewing their risk assessment tool, bringing forward cases. It takes time, but that's the kind of work that needs to be done. We do need to work collaboratively. We can't all do it as one agency.
Inspector, how do people get hold of this booklet? I mean, they might not want it in the house for obvious reasons, or in the car. You talked about it being available digitally as well, or how do people...
So it's on the CIPSI website, okay, if you go onto the Donegal page of www.cypsc.ie, and there's a link to it there on the page, and we hope to also get a link on the Garda website as well. But it is available in hard copy if you wanted.
And I'm sure, Grant, you'll have it linked on the Donegal Facebook page too.
And it is
not
for
now
professionals, so I would expect people to have it in their car. And
right? Okay, sorry.
house.
This is specific for professionals, because I actually thought it looked really quite useful for the general population as
We
well?
kind of thought maybe there was a lot of information in it. Might be too much for somebody who just, we don't want to overwhelm people. But the idea is that people working and coming across people that might have it. So that was the emphasis. But, we would like to see it around and about.
Yeah, I get you. Okay. But definitely if you're involved in professionally in anything in this area, you need to get your hands on this as well. Okay. So it was just so well laid out. I presumed that it was it's very useful. Okay. Anything that you want to add?
I was just going to say, Greg, on that, we do provide information packs to victims.
Okay.
The guards when we call back to them within the 7 days of an incident happening. But the packs, we say professionals, but it's really anybody who is, in a position.
A professional should have it.
Yeah. But professionals
we generally can choose to have looked at, but it'd be worthwhile. But a professional should have that.
We're talking hairdressers, beauticians, locksmiths. Across the board, any taxi drivers, shopkeepers, people that are interacting with.
Are people reluctant to get involved like that? Sort of to see something and say, right, I'm spotting something here. There's red flags here that I've read in this. I'm going to contact the guards. Do people be a wee bit nervous about that? Should they be?
They shouldn't be, but they may be. But we, as a part of our plan, are going forward are going to do briefings with people working in the community. We're going to start in January with hairdressers, and we're going to go from there. Just to create an awareness and start the conversation again. And again, when we give these presentations, we won't know if there's somebody in the audience that is a victim. They're presenting to work every day, and we don't know what's happening behind closed doors. And that goes across the board with every profession, whether it's the guards, the hairdressers, somebody working in the hospital. Nobody knows what's going on back home behind closed doors.
Okay.
And one of the things I think when we do the training that people say is that they're worried about not making the situation worse. Do we say something that will alienate the person, or and I suppose the message we're putting out there, it doesn't really matter, who it is that you're working with, you're just having a conversation. We're not asking you to say anything highly, you're not going to upset somebody, you're just asking questions, just making it routine, just giving them a bit of information. That's all you have to do, so it's maybe that's another piece. It's about breaking down what domestic abuse is. It is a big issue and complex at one level, but each little step can make a big difference.
Yeah, I get you. It's important information. Anything else that you want to add?
I suppose just for victims who are at home listening today, or who people that might think they know somebody that's a victim, just to maybe to keep a record of what's happening within the home environment. They can do it discreetly. There's an online app called Bright Sky.
Yeah, that's we talked about that in the past. That's quite useful for recording as well and stuff, isn't it?
Yeah, and it's an excellent tool. But just if they can record notes, because sometimes you'll find victims find that they might, they'll find they're losing their marbles because whereas if they're writing things down and maybe from one week to the next they're forgetting what happened because it may be because of the coercive control and somebody negatively influencing their thoughts, and again like that, if there's any witnesses to incidents, just to keep records of that as well, and that will all, if they do ever get the courage then to come forward to the guards, that at least they'll have a diary of events that have happened up until that.
Okay, you mentioned the app there, Bright, because the last time we talked about this, we got quite a few calls afterwards, people wondering where it's from. It's Bright Sky Ireland. It's available to download on the App Store for iOS or Google Play for Android. Siobhan, anything you want to add before we wrap up?
I just want to add in relation to the sexual assault treatment unit,
yes,
just for people that are experiencing sexual abuse in their relationships, or indeed on a one-off occasion, that it is a free and a confidential service, and it's available to all genders, and they carry out at the SATU, they carry out a medical legal examination, and depending on the time frame of when the incident would have happened. But they also provide health care and treatment of injuries and sexual health screening, cervical screening, and they would refer on to specialised services and counselling services when required. And I know that they have reported approximately an increase of 20% of people being victims of intimate partner violence attending to the SATU services. So, the information is in the booklet, but it's online if you Google the number there for the SATU 24-hour service as well.
Okay. Right, so, and just finally to focus on the professional side of things, because I don't want to in any way muddy the waters. The domestic abuse resource pack, if there is a hairdresser's taxi or people that work with them, any professional organisation like that might want to distribute it to the staff even, I don't know. How do they get hold of this pack, either physically or online? I'm sorry to repeat myself, but I know people will call in afterwards asking again.
We could maybe perhaps try and put some of these in the major Gardabar stations, because that's probably the place that people know best. They may not know where the SIPSI office is or anywhere else. So maybe
what SIPSI is, so you know, so the better the access, the better.
So we can get it out into the communities. And just to say as well, our own resource line, you know, the helpline is available not just for victims, but for people who want information and support. So again, professionals can access that in order to get information, and we also have copies of the resource pack that we can get out to people.
Okay, listen, thank you very much, all of you, for calling in. I really appreciate it. You've been hearing from Superintendent Gretty Sheridan, Inspector Siobhan Molahan, and Dr. Marie Hainsworth, who's manager of the Donegal Domestic Violence Services. If you need any numbers, any clarification on any information there, if you want to contact Marie, even in terms of, you know, available accommodation, anything like that at all, or contact us. Our number is 07491 25000 as well, and we can pass that on, because you might be very familiar with ours, and we can signpost you to all what we've been talking about so far. Okay, we'll be back with more on the programme shortly.
Today's 9 till noon show is brought to you in association with Ulster Tyres. Get your tyres ready for winter. Call in to Ulster Tyres in Letterkenny and Ballybuffet today.
Farmers know all about running a busy operation. They have their own instincts to help, of course, as well as centuries of experience handed down from one generation to the next. And then there's new ideas and innovations that are helping farmers work smarter today and safeguarding their farms for tomorrow. AXA Smart Farm Insurance is here to help too. In fact, it's the only policy where you can benefit from discounts of up to 30% if you have a low claims record. For a quote, search axa.ie/farm. AXA. Know you can. Terms and conditions apply. Claims free in your farm for the past 3 years. Windscreen claims are excluded. AXA Insurance DAC is regulated by the Central Bank of Ireland.
St Columba's College Dunurler are accepting applications for first year enrolment for the 2022-2023 academic year from Monday, November 8th until Monday, November 29th. Application forms are available on their website, stcolumbascollege.ie, or from the school office on 074 9131 246.
Candles, lanterns, Christmas trees, decorations and all types of lights. Everything you need for Christmas. Experience the magic of Christmas at Cooney's. Our biggest and best Christmas shop has outstanding value on lights and trees. There really is something for everyone at Cooney's Letterkenny Retail Park.
He's the sales director, finance director, HR director, and looks after IT, all without a single spark flying. Meet Sean, electrician and Citroen van driver. A great van is like Sean. It can do it all. Like the Citroen Berlingo, Dispatch and Relay. All come with multiple load volume and payload options, 3 front seats, steel bulkhead, twin airbags and Bluetooth as standard. The Citroen van range. Like you, they do it all. For more, see citroen.ie. Citroen.
Your local Citroen dealer is Highland Motors, Mountain Top, Letterkenny.
Join the Highland Radio Outside broadcast team this Tuesday from 1:30 in Letterkenny Credit Union for the final car draw of the year. 2 lucky Letterkenny Credit Union members will win a brand new Ford Fiesta ST Line, and there's €30,000 in Shop LK vouchers to be won. So tune in this Tuesday from 1:30 to hear if you're a winner with Letterkenny Credit Union.
If you're aged 60 to 69, you will soon be offered a COVID-19 vaccine booster dose. This is because cases are starting to increase in this age group. Your booster dose will give you the best possible protection against serious illness from COVID-19. You should get it around 6 months after your last COVID-19 vaccine. When it's time for your vaccination centre appointment, you will receive a text message from the HSE. For more information, visit hsc.ie or call HSE Live on 1800 700 700 from the HSE.
New this week in Home Store and More. All our Christmas tree lights are half price. Time to get Christmas ready with over 100 different types and colours to choose from. But better hurry, because when all our half-price Christmas tree lights are gone, they're gone. Also, all cookware sets and all bath mats are still half price. But when all our half-price cookware sets and bath mats are gone, they're gone too. So order online before 2 p.m. today for next day delivery. Or drop by your local Home Store and More. Home Store and More. A happy home.
Homeland Fuel offers, keeping you warm for less. 20 kg Super Therm, buy 5 bags, get 1 bag of hardwood logs free. 10 kg wood pellets, buy 10, get 1 free. Board Namona briquettes, buy 3 for €16. Shop in-store or online at homeland.ie.
Make Christmas for everyone this year at Dunnes Stores. Get your celebration started with 20% off wine and champagne. Give guests a reason to stay longer with tubs of chocolates like Cadbury Heroes, Roses and Quality Street, only €4 each. And for the perfect festive treat, mix and match any 3 for €5 across a range of medium selection boxes. Plus, with our 10 off 50 grocery voucher, you save even more. Dunnes Stores. Make Christmas for everyone. Terms and conditions apply. Voucher can be used on next grocery shop with €50 or more. Voucher excludes alcohol.
Christmas has come early, exclusively here at iMotors Drumkeen and Malin. Why not treat yourself to a new Kia or Nissan and avail of the fantastic finance offers available on all 221 vehicles. Order today and drive away in style in the new year. All new orders will be entered into a draw where one lucky winner will win €2,000 in cash. Call in today to iMotors Drumkeen or Malin or call 07491345567. T's and C's apply.
It's the perfect Christmas gift. A ticket to the Remembering Joe show starring Ben Dolan and the Dolan family with the original Joe Dolan band at the Mount Errigal Hotel, Letterkenny on Tuesday, December 28th. Book now at the Mount Errigal 074 9122 700.
Throughout Ireland, change is happening. Together we can build a community of support to empower those living with dementia. Highland Radio, proud to support Dementia Understand Together. Brought to you by the HSC.
Highland Radio weather updates with National Fuels Pierce Road, Letterkenny for all your solid fuel needs at the keenest prices. 9137 400 or nationalfuels.ie.
Okay, let's have a look at that weather forecast for you then. Generally dry today with sunny spells. They're developing after a rather cloudy start. Highest temperatures 9 to 12 degrees. In a light west to northwest breeze. Now, staying mainly dry tonight with clear spells. It'll turn cloudier from the northwest overnight with patchy drizzle developing on western and southwestern coasts towards morning. Lowest temperature, that's the national forecast. Sorry, I'm reading the wrong one. Here's the local one. Generally dry tonight with clear spells to start. However, cloud will gradually build overnight with patchy drizzle developing. Lowest temperatures 4 to 7 degrees in light to moderate southwest winds. It was boiling yesterday. Boiling, you know what I mean, by November standards, 16 degrees. I thought I was having a turn or something, and then I looked at the temperature gauge and realised that I may well have been, but it was also very warm outside. Right, a caller says, what about when the couple separate and the coercive control is moved on to the children on visiting days? Courts claim it's a parent being overprotective. There is an area that needs look at. Is that something you've contacted the Gardaí about and said that I believe? Even though I'm not living with someone, that there is a coercive control going on there. I'd be interested to see what feedback you would have got if that call had been made. I'm sure you have, by the way. I'm not questioning it for a second. My daughter was in a really bad domestic violence situation and getting her to make a formal complaint was impossible, and she still hasn't, despite him leaving her in D. Can I, as a parent, call to get advice on how to help her? The answer to that is a clear yes. The key thing with the Garda situation is and anyone can do that about anyone, by the way, and it would help you because you're obviously carrying a very big burden there because the person that you brought into the world and love so dearly, you're seeing them in a situation and you can't help and you feel helpless, and that's a terrible burden on you as well, and you have your concerns. So yes, you can ring the likes of Marie Hainsworth there at her centre, or ring the Gardaí. It doesn't trigger a chain of events, and I think that's what people might be afraid of. And it's the same when reporting when you're the victim of a sexual assault or sex crime. It doesn't necessarily mean that you make that call and loads of things automatically happen. Ring these groups and organisations. They're professionals at helping you, steering you in the right direction, giving you the right advice as mum or dad, I'm not sure which you are in this scenario, and make that call for sure, definitely. And I know you probably wanted to hear the experts say that, but I know that's precisely what they would say if they were still here. Greg, in relation to COVID cases, in my opinion, there are two groups involved in the spread of virus. First, the people who won't take the vaccine. And secondly, the businesses that don't enforce the COVID cert pass. Let's be honest, none of us wanted the vaccine, but for everyone's sake, we took it. I mentioned to a premises I was in at the weekend about not being asked for a cert. The reply was most of their customers aren't vaccinated, so that's why they don't ask. We all have a responsibility to keep our hospital as free as we can. There are a lot of people out there having their treatment postponed, operations delayed. This is a very serious situation. situation. And doesn't matter what government or Tony Holohan says, it's our hospitals that can't cope, and businesses who are not obeying rules should rethink indeed. And I know what you're saying, and rather than the vaccinated or unvaccinated saying back and forward to one another, wake up, you know, all that nonsense that people are still going on about, just think for yourself and say, look, regardless of your views on the vaccine, people are catching something. You might believe it COVID or you might believe it not, and it's clogging up the hospitals. And then you can talk about, well, you know, that's because of generations of underfunding in our hospital services. Be that as it may, it is where we're at now, and whatever our belief is, we can all do our bit to keep the pressure off the hospitals. And I think that's kind of the thrust of what this caller is saying. But there comes a point where our shared interest is what's happening in the hospitals rather than what our differences may be as it relates to government action or inaction or COVID or not COVID or whatever it might be. You know, we have a collective responsibility to think and look at the hospital and say what's going on there. My friend's coming from South Africa on holiday and he's in his 70s. I was trying to get him insurance for a car, but no one will cover him. Any insurance company, can you help? So it's someone, they're coming on holiday, is it? And they need temporary insurance, is that it? And you need to put them on as a named driver or something, but you're having difficulties. I wonder, is it the licensing issue? But if they were hiring a car, there's ways around that, isn't there? I don't know. It's an interesting one. And just let us know, are you trying to put them on your own insurance? Let us know, because... or is it a car that's lying idle? Give us more details and I'll be better equipped to be able to help get an answer. A listener says that she identifies with the mother who was on the phone earlier about her son. She too has a disability, and where she is not a student, she's tried to get a job all over Letterkenny, but no one looks at the CV. They only see the disability. Not fair at all. Another, a coach from the north coming into Donegal, has been stopped a couple of times for overcrowding and underage drinking. However, they're still in operation and still the same thing goes on. How can they be allowed to continue to operate this service if this is the case? I wonder, is that a story that's been passed through a number of people? I don't know, but give us more details as well. Right, I think that's where we have to leave it on the programme, unfortunately. Thanks to all of you who took part in the show. If you watched or listened, we